Operations Committee met together. Okay, first we're going to have the prayer by Nathan Sweet, and then we'll have the pledge of allegiance by Sheriff Barker. Please stand.
All right, let us pray. God, I just want to give you thanks for today. We're going to trust in you that you have a plan and a purpose for all this rain, God. And we just ask that you would continue to be our focus, be our driving energy and our power, God, that we would have our focus on heaven, have our focus on you. God, that you would just reveal your love through us and in us. You just help us, encourage us, help us to be relational. Our priority is a relationship with you, God, and then our relationship with others. So I pray over this committee, I pray over this county, that you would just be our guiding focus, God, and we just ask this all in Jesus' name. Amen.
Amen. You would join me in salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Next is the approval of agenda. Commissioner Adams.
Can I make a motion that we add the resolution for the building codes?
Yes. Have a motion, we have a second. Second. Any discussion? All in favor?
Aye.
Where would you like to add that?
I guess just maybe add it to the front.
We can do it, we can actually do it next. Is that okay with everybody?
Yeah, sure.
All right. Jay, do you want to talk about the resolution?
Be glad to. What you have before you is a resolution adopting the 2018 International Building Codes, and that would include the residential code, the actual building code itself, the plumbing code, the fuel gas code, the mechanical code, the property maintenance code, and repeal all prior editions of those codes that we passed before. This has given us a chance to get up to speed with the most latest codes. I think right now we're working on the 2012s and 2013 on energy, I believe, Mayor, isn't it? We're staggered there, but we want to get to the most recent versions of these building codes. The state law allows us to adopt them by reference. We don't have to put the entire code book in our resolution. If anyone wants to see the code book, they can pick up a copy and check it out in the county clerk's office or downstairs in the building commissioner's office. Any questions on this resolution?
Commissioner Meade?
Yeah, we haven't had a lot of time to look at this, but at least I didn't find it until I just got it.
Right.
But on page 2, there's in that section 1, it has 3 places in a row where it replaces the word shall with may. What that really means is that is not a requirement.
That's permissible when it's made.
Okay. And so if it isn't a requirement, could we have just deleted those sections so that it's not a requirement? That still allows them to have it if they want, right?
No, you want to have the written word there so they can enforce that written provision if they so desire.
Well, but may cannot be enforced. That's optional. You don't have to have
It's
it.
discretionary. May is discretionary.
Yeah.
They may. They could enforce, yes. It's discretionary is what that means. And that's what they've chosen to do. This has been reviewed by the codes department and the building commissioner, and this is the way they would like to see it.
Okay, then in just below that part, there's a part where it says in each garage, these smoke alarms shall be specifically approved for use in garages. It doesn't say that, does it say somewhere else as far as the context that their detectors will be required in all garages? Or is that another, if you have one there, it has to be certified for use in a garage?
It has to be certified. Yeah, in some places you do have to have smoke alarms in a garage, and they have to be a specific brand of smoke alarms.
Yeah, they have to have certain capabilities.
Exactly.
Yeah. Okay. Okay, thank you.
Any other questions I can handle for you? Yes, sir.
Do you approve of all of these changes?
Yes, I'd like to say so, but I don't know all the details, Commissioner Jameson. This is all coming from the codes enforcement. I put together the resolution as they chose to enforce it or as they want to see it. And we have a lot of great people down in that office. I yield to their opinion. And I know they put a close set of eyes on this, but as far as any specific provision, no, I'm not recommending any of it, but I do endorse their work. And if they're bringing it forward, then I believe it's probably a good thing.
Well,
I'll have Margie here. She couldn't make it tonight, but Margie is the one that orchestrated all this and went through the entire code section and picked out the things that needed. She was here last month, and she'll be at County Commission. So if you have specific questions about this, it'll give you time to digest it, look through it. If you need a copy of those books, we'll get them to you. They're quite expansive. But if you have specific questions, Margie will be here next Monday night, and she'll be glad to entertain each of those for you, sir.
Jay, you might add that we have to adopt that.
But we certainly, would help me as far as the enforcement's concerned, that we do have the most recent additions on file. We've been struggling for
Every so
years.
many years, we have to
Yes,
update that.
absolutely. If you remember, we used to be under the old Southern Building Code. That is no longer in existence. Everybody now is on the International Building Code. It's uniform across the country.
Mr. Meade?
Just a quick thing, and I'm assuming because this is done by resolution of the county, that means that if we decide later on there's some little item in here we want to modify by resolution, we could do that.
You're exactly correct.
Great, thank you.
Anyone else? Commissioner Creasy?
yeah, you're on the planning commission.
That's correct.
They have approved it already.
Motion to approve.
Have a motion and second. Any other discussion? All in favor say aye.
Aye.
Thank you for your time.
Opposed? Motion passes. Andrews County Animal Shelter.
I think this was referred from full commission.
Correct.
We had an animal welfare task force meeting on Friday. We had it in this room. I think we had all but one of our members was there. We had several members from the public, and we agreed to put together a subcommittee that is going to work on the ordinances. So we had 3 separate exhibits that were submitted by citizens. The committee took those up. We got several volunteers from the public. Brian and Leah from Animal Control are going to work with them. Lauren Boloski is the attorney who serves on the Animal Welfare Task Force. She actually has a passion for the ordinances, so she's going to work, and they're basically going to put together a plan on how to present this, what can be done. They'll eventually come back, work with commission, the law director, the sheriff's department on the enforcement side of things. One of the things that we talked about in that meeting was if we get into stricter standards, for instance, on tethering animals, we had one group that was there that was willing to maybe partner and help folks get fences, and because we have a lot of people that don't have the resources to build a fence if we all of a sudden ruled them in non-compliance. So we're putting together a good action plan and supposed to meet again in 2 months to review the work that they've accomplished. I thought it was a very productive meeting. We got a lot of compliments.
Any questions? Commissioner Anderson?
Thank you, Mr. Chairman. This is sort of related, but is there any follow-up or new information on the incident in Andersonville with the animal abuse case where the dog had hung itself on the fence? Was there any follow-up? Anything about that?
That particular one was not, there were no charges filed.
Okay.
So the one animal abuse case we have a member of our task force who is with the sheriff's department. He's going to discuss with the district attorney general, perhaps expediting the presentment to the grand jury. I don't know what we can do there, but we actually have 6 animals in our possession, which is half of the capacity of our facility. And those animals are doing very well. We had the first hearing. I think those animals were confiscated in January. We had a hearing, I think, on April 1st, and the judge bound that over to the grand jury. And so the judge did try to convince that particular owner to surrender the animals because the boarding fees are in the thousands of dollars right now. I can't remember if the number's $4,000 or $6,000. And the owner is unwilling to do that. So that's the only active one. I believe the sheriff also has one where the sheriff's department and Leah van in our office went out, and there was a cat that was abandoned, a dog and a cat, but the charge is actually against the owner for the cat because it was deceased. So,
Okay.
Thank you, Mayor.
you're welcome.
EMS Director Nathan Sweet.
Thank you, Chairman Isbell. Wanted to take this opportunity as we distributed to all of County Commission the EMS action plan for both short-term and long-term. We presented that to everyone by email, so I believe everyone was able to get a copy prior to this meeting. But wanted to just take a moment and talk a little bit about that. Really, the breakdown of that is working off of the audit that we got last year, working with that plus any other items that we have included ourselves. So for many of you that have had the time to review that, we did talk about several things that were discussed in the audit, and we really tried to link back anything that was discussed in the audit. We tried to link that back to specific areas of the audit. So it gives you that shortcut to be able to take a look at what we wrote and to be able to reference back to the audit as well. But there were a couple items that we added to the plan that weren't really thoroughly discussed much in the operational audit we got last year. And those two items were the communication efforts from our department, Mayor Frank, surrounding EMS with the stakeholders, which is not only the county commission, but the public at large, to be able to more routinely be able to report the information and data that EMS has, trying to find out what is the most appropriate information to be able to communicate, and what's the best format to do that in. So that's something that we'll continue to work on. And then the other one that was added was our working with the first responder departments to really try and find a better way for us as a whole, county as a whole, but EMS as well, to better work with them, to improve them, to advocate for them, whatever that may look like. And I really believe that's going to take a special task force to take a look at that. How can EMS work with our fire departments, our first responder departments, law enforcement, everyone, to say, hey, how can we improve delivery of EMS as an interdepartmental throughout the county? What does that look like? And so I really, the task force or the plan really talks about that, but it doesn't lay out how that's going to be done, because there's a lot of stakeholders that were not involved with the audit or with the plan that would need to be involved with that, really, to get the communication and effort to see where can we best improve that. I know that especially with the volunteer departments, they've seen a lot of struggles lately in recruiting volunteer firefighters to come in and work in their organization. So what are ways that we can partner with them to help that, to improve that? So I wasn't completely sure how this committee itself wanted to discuss the plan, but really we kind of broke down each of the statements, the issues, made a statement of those, and then we kind of started breaking it down of how can we address this? What are the things that we can focus on over the next several years? And what are some goals and achievement items that we would like to achieve? So it's kind of broken down by year that way. And then we, at the very end, we start looking into the financial piece of that. What does that look like? What are we looking at? As was discussed in the document, the reason there are 3 different budget models is because we presented 3 different budgets this year, not knowing what direction we might go in. Something to consider is that this is not a set in stone document, because the budget may not look like one of those 3 when it's all said and done. So we may have to go back and update that information. You all may decide that there are some other goals and opportunities that we could take a look at as well. So that this document is kind of a dynamic living document that doesn't need to be, well, this is set in stone and this is how it's going to be. this is an opportunity for us to work with commission and everyone to say, hey, how can we address these things? How can we move forward with these things and better provide the EMS to the community? So I really do appreciate your all's patience in us being able to put this together. I know it was April of last year when they finalized the audit, and we worked on this, probably started towards the end of July, that we started working on this plan and getting it together and getting the feedback and putting it together to submit to you all.
Commissioner Creasy.
Do you attend the fire commission meetings?
Not all of them. I do attend some of them, yes, but I'm not able to make to all of them all the time.
When you were talking about partnering with the volunteer fire departments, I thought that was a perfect place to do that.
Oh, absolutely. But I think it needs to be, in my mindset, it needs to be bigger than that. How can we work also with law enforcement, especially that they're carrying of Narcan? So we haven't started addressing that situation or advancement opportunities. And I know that the sheriff has been, him and I have had opportunities to sit down and discuss things, but we haven't looked at that. And I know his department would be more than happy to look at those things and see how we can better serve the community as well. But we haven't started doing those yet. But yeah, that absolutely would be a great place.
Commissioner Yeager.
Thank you. I know there are a lot of categories, but there's one I just want to ask about. It's the replacement of facilities.
Yes.
And at the end, you say a station location study should be conducted. How many stations do you think is the optimal number for this county?
Well, I guess it depends on what we're trying to achieve. So if we're trying to achieve a faster response time for every community in the county, then it's going to be more than the 6 we have now. So ultimately, it's based on, especially when we establish our response time factors, that's going to help drive some of it. But ultimately, it's going to be, what are we as, not just EMS, but we as a county, what are we trying to achieve? Because that would determine it. You know, getting to the Brownsville and New River areas, it would take a station out there to shorten that response time. Claxton is another one that we are having a slower response time to because we don't have a facility out there that's coming from Clinton or from Oak Ridge. So looking at the same time, part of the facility study might be, well, hey, if we could take the one on East End Oak Ridge and actually push that closer to Claxton, it might serve it better, but then you're also cheating away from Marlow area if you do that. That's why the audit did not have a facility assessment done, right. And we need to have one based on our historical information, our call volume, our runs that we've done. We need to sit down with somebody that can look at that data, put it into context to be able to say, here's where you're going to maximize the best. And that would tell us if we need to add stations or if we need to just stay the same and move them to a different location.
Thank you.
Any other questions?
Thanks, Mr. Chairman. Nathan, first I want to say thanks for this is your business plan. Is that right?
It's our short-term, long-term plan, the strategic plan.
So, and I like it. I mean, I guess my question is this what you intend to run by?
So this is a guiding document. Yeah, this is a guiding document that we can use, but as I said, it may have to change, and that's even said in the document.
Yeah, I'm not trying to say that you can't do anything else or
Sure.
You can't change it or you can't add to it. I'm just asking, is this the document you're presenting to commission to run EMS by? Is it sort of your business plan?
Yes, for us to be able to communicate and discuss with commission on the direction to head forward.
So my question is, what happens if certain things aren't met during that time that are outlined in the plan, excuse me, as presented?
So then we would just have to go back and rework the plan and say, okay, if we're not going to provide that now, are we going to provide it later? And then we would move it, and we would just have to be able to report to this body of what that looks like, what that means. If we decide we never want to do it, then we remove it from the plan. So it would be if we decide, hey, we're not going to do this right now, we're going to push it back to a later date to be determined, then we would continue to work with this body to do that, to determine that and then update the plan move forward.
Okay. And I'm just one commissioner, but, and again, I appreciate the plan. Okay, one thing, I've at times said, you know, we don't see a business plan. We see all the other things that have been requested in the audit and all these things, and we've funded many and done a lot of different things, but we didn't see the plan. So that's why I'm asking, is this the plan?
Sure.
And I think your answer is yes.
Yes.
And so for me, I'm going to make sure that when that plan is being presented, that's the way it's going to be operated going forward. I'm going to look at that plan and I'm going to go to it a lot. And when you come to the body and ask questions for increased funding or to make an acquisition, I'm going to go to that plan and I'm going to see if it ties into the plan. Understood. And again, it's not to say you can't. No. I want to be very clear. I'm not saying you can't do this or you can't do that. I'm just, I'm going to work with that plan, and that's going to be kind of sort of my Bible to work from as it relates to EMS.
I find that very appropriate, Commissioner.
Okay. All right. Thank you, Mr. Chairman.
Mr. Creasy, you want to speak?
Staffing,
Yes, sir.
are you working with the HR department and trying to fill your vacancies?
No, we haven't been working with the HR department. Big factor there is we don't have a whole lot to recruit with. The biggest thing, the question that we receive is what's the pay look like? And unfortunately, we're at the very low end of that. So recruiting efforts have been a little bit more difficult on that standpoint. In regards, usually our best recruiting has come by word of mouth in the local area, but we have had opportunities where we had a gentleman not too long ago who's moving to the area from another part of Tennessee, and he found us by a Google search on our website. He came down and spent the day at our service, and we drove him around to the different stations, and he met with some of our staff, and he was able to see our response area and to be able to ask questions. And through those efforts, he's decided to come on, but he can't come till May when he moves to the area. But he's also the EMT basic. He's the lower level of where we're really the hardest part is trying to find paramedics. We are, as I did email, I believe, all of County Commission, the mayor and I are also working with several counties around us that have their own EMS department. I think we reached out to 8 different counties to invite their mayor and their EMS director in, and we're meeting with them later this month to start talking about how can we as a regional, as EMS departments, work with each other, because really what we're kind of facing right now is we're trying to steal employees from each other because there's not as many coming out in the workforce. Something I haven't shared is I was reached out, TCAT reached out to me last week and said that they're going to be looking to see if they could bring the ability for us to partner with TCAT to be able to teach our own EMT and advanced EMT program through them, but in-house. And that would create us an opportunity to go back to recruiting students in high school, recruiting people in our community, to give them a career path to work with, as opposed to we're waiting for them to get a license and then trying to get them afterwards. So we've been in the schools, we've been in Roane State and some other schools trying to recruit there as well, but we have not been aggressively working with HR to pursue after that.
Yeah, reaching out with the other counties and all, and they learning from you and you learning from them, all that's good, but that's not staffing.
Sure. Yeah.
You're increasing your employee staff. It would seem that the HR is professionals in staffing, hiring people, and that looks like, I think if I was in your job, I'd be enlisting them plus doing the other things you're doing. We've been understaffed for how long now?
We've been understaffed this whole fiscal year.
That should be your number one priority, my opinion.
Yeah.
So,
Anyone else? Yeah, I'd like one more, please.
Looking at your call volume over the last 3 years plus expected, and your largest number was 2017, 9890 911s and 7267 in convalescence.
Yes, sir.
It looks like you don't really anticipate those coming back to 2017 level.
No, not as aggressively. Not 2017, that 911 call volume was the highest that we have ever done,
Sure.
that I have on record, going back to 2006. So it was kind of an anomaly year for 911, where it came back down this year to be 9,200s. We've been over 9,000 for past several years, and it usually kind of fluctuates either up or down, 100 or 200 a year. But that 2017 was an anomaly for 911.
In convalescence, you see that being a peak year also. What's that? What do you suppose that's about?
So it's not actually a peak year. It's not the highest year that we've ever had on the convalescent side. There wasn't really an explanation for why such a decrease, but I've even talked to other service providers that they've seen a decrease. As a matter of fact, I was talking with the Priority EMS not too long ago about what they're seeing with staffing and some other things, and he expressed that they've seen a drop in the convalescent workload, as has most everyone else. Not sure the reason behind that. I know for this year, we have been giving some calls away because we don't have the staffing ability to handle those calls. So this year it's dropped down even more because that's part of the factor for this year.
Is that the refusals category, or is that the patient refusing?
Patient refusals.
Okay.
Yep.
Okay.
Where we respond and then the patient decides not to go with us.
Okay. Thank you.
Anyone else? Yes, Commissioner.
In one pretty thing, your list of mandates, the state of Tennessee EMS division requires certain types of equipment and licensed staff to maintain the service's A rating. Does an A rating require, is that the only requirements, a certain amount of some kinds of equipment and licensed staff, or is the response time in any way tied into
The
that?
response time is not tied into it. It is a staffing, having a paramedic on the truck and having the paramedic equipment, medications, cardiac monitor, those types of things.
Okay, how close are we to not meeting that requirement?
We just went through our state audit, and we didn't have any change on that. We're not really close to that. The biggest issue is the ambulance in Oak Ridge that we have temporarily shut down. We are staffing that with overtime. And we are allowing for 2 EMTs to work on that truck, but they're not working in a primary 911 response. I mean, if that's the only truck we got, then a 911 call they're going to go to. But when it's a red lights and sirens emergency response, it's still a paramedic truck that's first priority to go to that call. So we're not really in threat of that unless we continue to see that decline with staffing.
Okay, do you think that there's I feel very pessimistic that you're going to be able to keep your staffing where it needs to be at the pay rates there are now.
Correct.
I mean, they can make more money working at McDonald's
Correct.
than going to scenes of car accidents. Somehow I see that's a tough sell. Thank you.
Any other questions? I've got one, Nathan.
Yes, sir.
And you touched on this briefly, and I know you're going to be first up when we talk under the budget discussion. But how much does the budget requirement affect this plan? Now, once you get your, and this is kind of what I've seen in your opening statement, once you get your budget, will you change this plan, adapt, or say, based on this budget, some of these things are, how much is that, your budget, going to affect your plan?
So it ultimately depends on what kind of budget is passed. So if we pass a budget that doesn't have any advancements, then it will have an impact. We'll have to look at delaying some of these implementations and posting them later, or it's going to make it that much harder to actually even try and achieve them by the time frame that we put in the plan. So in that context, when we do pass a budget, we may have to review that and then just resend it up to commission based
Come
on
back
this.
with a modified plan.
Yes, sir.
Okay. Okay, the next thing that we're going to take up, does anybody got anything else? The next thing we're going to take up is budget discussion, and this is by Budget Chairman Commissioner White. And I applaud him for what he's doing is he's actually reaching out to the Operations Committee, because the Budget Committee is tasked with a very difficult situation this year. There's a lot of needs, and how are they going to present this to full commission about going forward, how we're going to handle these needs. And this gives the public a chance too to hear from all the people that's took the extra time to come, and I really appreciate that, because it gets the word out, to the public, because they can see firsthand what your needs are, and as we go forward, there may be a little bit more understanding. But I really appreciate Commissioner White for doing this. So you're up first.
Yes. So I also wanted to say thanks to Chairman White for giving us the opportunity to come before this committee and basically the other half of County Commission to be able to talk about our budget and be able to express to you all as well. We've been able to build off financially. We've been able to build off rather well this year in some regards based on what County Commission did for our department last year or this current fiscal year. As we have been sharing the information and communication with you all on the new cardiac monitors and new ambulances, that has made a tremendous difference in our organization, not only for the workforce, the paramedics that are using the equipment, but as well for our ability to deliver that service to the county. So I do want to thank you all again for what you did this year, and we're looking in next year's budget plans, we're looking to build upon that. Now I know we've only spent time talking about operational budget, but if it wasn't sent to you all, I'd be more than happy to send it to you all. There was quite a bit of documents that I submitted when we submitted our budget. And talking with Finance Director Natalie Erb, she recommended that I go ahead and submit 3 budgets for consideration, much like we did last year. 2 budgets that would have optimal improvements for our department, and then a 3rd budget that would basically make no changes or very little changes. And so that's what we did. We provided that document. At the beginning of that document, there's a detailed bullet point of saying this is what an addition was and this is how much it cost for that addition. So it gives you guys the opportunity to be able to take a look at that and look at it in individual pieces, not just a whole big budget. So I do hope that everybody, if you don't have that, I'd be more than happy to send that out to you. But it did break it down that if we're going to look at making some of these changes in line with the budget, this is what it would look like. But then it also gives us the opportunity, if we're going to work together, to say, okay, we want to make some changes, but not all. It gives us an opportunity to discuss what different changes and what that would look like and what you would be adding or subtracting. So it really does give you a little bit of a working document for us to be able to continue to discuss how is it going to look for going into the next year. What are we really trying? What's the main priorities that we're trying to focus? For me, the biggest priority is the response times and really getting the ambulance to a 911 call. The biggest focus there is we have to separate the convalescent and 911. We have to designate those ambulances that are going to be used for 911 responses to meet the emergency needs as they come in. Where our system and current model right now doesn't have that. The 911 trucks are still helping in the convalescent because the convalescent's not able to do all that workload. So we really need to push, in my mind, we really need to have that focus of how can we do that? How can we separate those services and still make it as best functioning service as we possibly can for this county? So really just to kind of break it down, budget number 1 was the optimal budget to be able to put in these implementations, to put in some of these changes that we're talking about at the commission level, at the same time to make advancements and make some improvements to our department. A big part of that is the recruiting retention. So we went to our staff and said, what kind of schedule, looking at a 24-48 schedule that we currently work now and we've been working in since the 80s, I kind of wish McCamey was here because he could be able to talk about that. When EMS started in the 70s, it was a 24 on, 24 off schedule. In the 80s, they switched to the 24 on, 48 off schedule, and we've been running that for several decades now. There's been a lot of changes in advancement, not only in the workforce, but also in what the requirements are of our profession. So our staff is working 56 hours a week on average, and we're paying them paramedics starting out at $11.43 on the hour and EMTs at $9.41 on the hour. Part of this was we got to look to, can we make this workforce more appealing? So we asked our staff what would be their preference. And then we also asked people that were going through school at Roane State, what would be their preference? And based off of that information, kind of working with that, that's where we got to the 24/72. So they work a 24-hour shift and then they're off for 3 days. It brings them down to a 42-hour work week, which is more in line and more normal for many public safety entities. And that's a direction that we wanted to present it. So that was presented in our budget one. So, budget impact, budget one implements all new positions, implements new schedules. It improves our 911 response capabilities, it improves convalescent response capabilities. It will increase convalescent calls because we won't be in a position of giving those calls away. It would improve retention and recruitment. It would improve community outreach and beginning development of a community paramedicine program, which I know we've shared in years past. And it also funds training and billing compliance for some office staff. That's really the highlights for budget one. Budget two, pretty much the same highlights. We keep with the 24 on, 48 off schedule, which decreases the ask that we have to you all, to the county. It decreases our financial ask, but it does implement pay raises for our staff. And the budget three was basically not making any changes at all. I think if we stay where we're at now, we stay at the same pay, we stay at the same structure, we'll continue to face staffing issues, and I think that they'll be worse and more exaggerated than they are now. So again, this has opportunity to be a workable document, a workable recommendation, and we'd be more than happy to have a workshop or a discussion to continue to look at that and work with you all to see what we can do to build off of what we did this year, to build off of the audit, to improve services.
Now, I understand that your first budget, was it approved out of Budget Committee?
It was. Budget one was approved out of the Budget Committee.
Okay. Questions?
In what category? Question. Budget?
Budget.
I'll ask it anyway.
Yeah, go ahead.
All right, is that okay?
Yeah, that's what it is, operations.
Okay. I've been trying to educate myself by reading, not articles, but, peer-reviewed kind of articles.
Okay.
And it looks like that I would much rather have a heart attack in a second hour of a shift than a 23rd hour of a shift.
Okay.
Do you, I know you guys like 24s, but the longer the shift, the more errors, the more injuries, the more everything that can go wrong happens.
Understood.
Do you ever see moving to 12s?
And I shared this at Budget Committee. If I had to go back on a truck full time, I'd prefer a 12-hour shift. That's me personally.
Well, you're the director,
But
though.
my staff-
You can tell them what shift they work, too.
Well, sure, and they could tell me bye.
Oh, sure, yeah.
So, my job is not a 24/72 or 24/48. I'm asking the staff, it's their job. What do they want out of their job? What can I recruit with? The 12-hour shift was the least desirable shift, not only amongst my staff, but amongst the students that were at Roane State. So I could make that change and implement what I've already found in just my narrow research locally, the least desirable shift. We could take that risk. We could take that shot and see if it works. But we've already got the feedback that that's not what's preferred.
I understand. That was just my question, though.
Sure.
Yeah, if we got any type of operational questions, feel free.
Hey,
Commissioner
can I piggyback off of that? I'm sorry.
Sure.
I know. And I completely understand this 24/72 schedule and the vacancies we would look at being filled would be a monumental task for us to take on and try to move to. The same number of people to do this schedule is the same number of people it would take to do a 12-hour schedule. I completely get that. That would be, I'm not guaranteeing that I could fill all the positions, but me and my staff believe that there is a lot of recruitment possibility out there. It's a unique schedule to this area for us to stand out to prospective employees to get them here. There's a lot of confidence with my medics and my officer staff that we could recruit with something like that. I can't guarantee we can fill it. And as I share with the budget committee, if we can't fill it, we're not just going to, hey, budget's passed, we're automatically changing our schedule and we have all those vacancies. We're going to go out and recruit the people before we make a change to that schedule. And if we can't recruit enough people, then we don't make a change to that schedule. We basically revert to budget 2, and we give whatever the difference was, we'd have to give that back to the general fund.
Commissioner Anderson?
You said it was a unique schedule to this area, so are most of the neighboring EMS on the 12-hour shift, or is
It varies, no. Most of them are on the 24/48. Private service is more so on 12 hours. So you look at how busy a system is, and so you may have places, Union County, Scott County, that may not be as busy, and 24-hour schedules is perfectly fine. But you go over to Knox County, which they used to have 24-hour schedules over in Knox County, which I personally couldn't believe. But they're predominantly 12-hour schedules, because in 12 hours, they're going to run 14 plus calls. For us, in a 24-hour period right now, our busiest truck is probably running about 12, but some of that is convalescent calls. So we're going to be decreasing that so that we're not pushing them as hard. But predominantly, it's the 24/48.
Commissioner Creasy?
Now, I'm still on the staffing. Are we running ads in the newspaper to recruit new ambulance employees?
No, sir, we're not.
How are you going to get them? Are they supposed to come to you, or are you seeking them? How are you seeking new employees?
So we're seeking them. Well, this guy that's moving from the area, he did some by Google search. We've tried doing some posting in the past, and we've tried doing some, like, even national level posting, like on an Indeed or something like that, and we had no responses when we did those types of things. But most of it is by word of mouth. It's by us going into the community college. One thing we did is, out of our own money, we went, not the EMS money, but our own personal money, we went to the community colleges when the students were going to go take their National Registry exam. We provided some snacks and a little flyer about our agency. We did that as a kind of a PR recruitment event. A lot of it is we are a training site, meaning that students going through Roane State come to our facility to do clinical work, to ride on an ambulance. So that gives us a great opportunity to go ahead and look at the people that are going through school, finding out which ones we want to recruit and which ones we don't. So our staff is being able to say, hey, this person is a quality applicant. We should look at pursuing them, and we'll talk to them. We had just a lady the other day that was doing a clinical, and probably 3 people within a span of about 15 to 20 minutes from our staff said, hey, we would love for when you graduate to come and test here, to put in an application. I've heard of staff talking about other EMS professionals when they're over at the ER, because we run into them, telling them we have openings and for them to come put in an application. So it's not a passive stance. The difficult part is, for the most part, first questions asked, what's the pay scale look like? So we tell them, starting pay is $11.43 for a medic and $9.41 for an EMT.
Say again.
Starting pay for a paramedic.
Tell me again.
Yeah, starting pay for a paramedic is $11.43 on the hour. And a starting for an advanced EMT or AEMT is $9.41 on the hour. So, and as we've distributed, looking at the list of how we compare, I mean, and everybody's going up. Morgan County just raised theirs $1.50 across the board per hour. They're going to be at $13.31 for paramedics starting. Union County's getting ready to go up. Scott County's paramedics start out at over $15 an hour.
How many people do you have that's making 1143?
I have to go back and take a look. There's not many, but there's a lot that are on the lower levels. There's a lot that would be, around $12.
Most are making more than 1143.
A little, but not much, right?
Commissioner Jameson.
Do you have the
Hold on.
prerogative to raise that?
Yes, we've asked for that. That was budget number 2, that we asked for the pay raises as part of that. And it's broken out on what that would take a look like. So if we stay with our current schedule.
I'm trying to help you.
No, I get it. If we stay with our current schedule and we're not looking to increase that, but we raised our pay, what would that take a look like? And how much would that cost? So initially, we were looking at paramedics up to $13.25. The average right now is $13.30. So we would actually, even at $13.25, we would be coming in below average.
If you had a guy come in and had 10 years experience as a professional, full trained, what would you start him at?
He'd probably be at around a level 2, level 3, which is about $12 an hour.
In other words, you wouldn't start him at 1143.
No.
Okay. You have the prerogative to decide what you start him at.
Yeah, based on certain factors, again, if somebody's got 10 years of service, hey, that's great, but you don't have 10 years with Anderson County EMS. So I can't say that I can give you full credit for those 10 years when I've got employees that have been with us, 10 years and put them at the same pay. I personally don't believe that's what we should do.
You need people.
Yeah.
You got to figure some way to do it.
Commissioner Jameson.
What benefits would your employees able to sign up for? Benefits?
All
Besides
the county benefits. Oh, yeah.
Hospitalization insurance,
Yep.
medical,
Everything that,
all this
yep.
kind.
Oh, yeah. They're able to sign up for all of that.
Commissioner Mondale.
Done, Commissioner Jameson? Thank you, Mr. Chairman. Just to piggyback a little bit off of Commissioner Creasy's comment about the HR, I'm in the staffing business, you know that. I think maybe we talked about that. I see no danger in using HR. I see it as a way to limit risk and liability. I think the HR could be used as a tool to negotiate, to get the, not saying you don't have the ability, but obviously you're short-staffed, so I couldn't imagine being the director and trying to be the guy to run around and be HR, the director, run financing, and all the other fun things that come along with your job, which is a lot. And I know you probably feel as if you can handle it, there's no problem, but if we look at the information presented, there is a problem. We don't have enough people. You're presenting information to tell us, well, we don't pay them enough. The numbers you have given us, and I'm not here to debate them, but at one of the budget committee meetings I went to, and I've seen some information, in fact, you provided me some information, it said there's roughly $1 million spent in overtime. Now, when you give us these numbers of 1143 and 941, guess what those do not include? Overtime.
Sure.
So if you sat down with HR and you negotiated, HR might say something to you like this. Well, Mr. Sweet, if we took the $1 million and we bumped up the salaries and maybe we did a 12-hour shift or whatever, and look, I'm not EMS. I'm not going to sit here and say I know everything about it. I love you. I love your employees.
Yes, sir.
I do not think there's anyone in the Anderson County EMS that is trying to tear this county apart. But I'll just make that comment. So my question to you is, what was the budget last year? And if you don't know, it's okay to say, Commissioner, I don't have it at the top of my head. I'm not here to embarrass you.
Yeah.
Like Commissioner Creasy, I'm here to help.
I think it was just south of 5.7 million.
5.7. And you said that the budget committee passed option 1, and I apologize, but when I read option 1, there's no number. There's a lot of numbers, but there's no, unless I'm missing it.
Oh.
But I don't see one number that says option one is 5.72, or am I missing it?
Well, I believe in the complete document, I think it's like 32 pages, the document we sent, it does have a total in that.
Okay, so what is option one in terms of the overall budget?
That, I don't have that in front of me.
Okay, it's okay. So let me just ask you this question. I can get it, Nathan. Yeah, we'll get it. I don't want you to get like I'm trying to bash you, because I'm not. Just trying to understand it. And I want to thank you for coming. I want to thank Chairman White for coming. I would like to hear from Chairman White to hear what his little quick scenario, summary is of what he's been going through with, and not to complain, but just to give us a quick, but I think you summarized it very well, Chairman, and I appreciate you doing this. So let me just kind of hurry up here. I want to know from you, what do you see as the Director of EMS, the roles and the responsibilities as it relates from County Commission to EMS? What do you perceive our mission and our job to you as the chairman and the whole organization as EMS? I'm curious to know your perception on that.
Well, ultimately, we respond to, or we report to this body as in regards to the financials. The operations side of EMS is something that falls under the mayor's jurisdiction. Something that her and I work and manage, but the financial piece resides with the commission. So there are a lot of things on the financial side beyond just the funding aspect, but as well as the rates that we charge. That all goes through county commission. Any legislative documents as well, whether it's a resolution that governs EMS and what it responds to. But I don't view us as necessarily at the same time, I don't view us as a separate entity. I view us as this is something that we ultimately work together. Myself, commission, the mayor, work to figure out what we're wanting to provide. One thing that I've enjoyed from several commissioners that have given me the time is for them giving me their feedback. I mean, ultimately, you're all residents as well. But you all hear from residents also of what's the feedback that you're getting to be something that we can use as we go through and operate. So I don't know if you're saying this or you're asking this. I don't view it as a separate entities. I view it as we have joint efforts, but our paths cross mostly with the financial side.
Well, my question was really, what do you see our jobs as commissioners to you in EMS? And I think you touched on a lot of different things, which I don't dispute, but maybe I can say it this way. For this commissioner, my job is to ensure that the tax dollars that are paid into this county are utilized in a very effective, efficient manner and maximize to provide services such as EMS, which is obviously very important to save lives.
Yes, sir.
When we go code white, that bothers me. And I know it bothers you, and I know it bothers your men and your women. But that tells me we got a pretty big problem. And we can't just say, well, we don't have enough people. And in my opinion, we can't just say, well, let's throw a little more money at it. That'll fix it. Because it doesn't fix it. What does fix it is what we're doing here. We all need to get together and come around. So let me just say it this way, and I'm not going to talk all night. We got a lot of people here that want to talk about their budgets. I'm going to make a decision based on what's best for the taxpayers.
Understood.
I'm not making a personal decision for Tracy Wandell. I'm making a decision on the people that I serve in my district in this county. And I'm going to be honest with you. As I sit here tonight, I would be doing a disservice. And you don't have to send an email. You don't have to call or tell anybody. They'll be able to watch this program. You'll be able to tape it, snip it, and give it out to people on disc, okay? And I'm not mad, I'm just speaking from the heart. I would be doing a disservice if I didn't make sure that the funds we give to EMS aren't properly the amount to make sure EMS is running properly. So I guess what I'm saying is this commissioner probably needs to look at other options. Yes, that will include, because how foolish is it for me to sit here and just go, I'm not going to look at other options? I mean, what if you came in here and said you needed $15 million? Am I supposed to just give you $15 million?
No.
No. So this isn't a threat. This isn't, oh, I got you, Nathan. I done told you I loved you. I sat down and met with you for about an hour and 45 minutes. There's several things I asked you. Haven't happened, but that's okay. Am I mad about it? No. It really bothers me that you kind of feel as if your team, your members on your EMS, see us as problems at County Commission. That tells me that they see us as the problem. When we fund, is it a problem? No, it's not. So I don't know how we fix that. I asked to meet with you and all your members. I thought it would be very beneficial for all of us to come together in a room and talk. You didn't seem to be interested in that because you had your reasons, and I'll respect those reasons. So again, I'll shut up. I'm going to move on. But we as a body would be not doing our duties if we didn't look at other options as it relates to EMS. Now, we all can run around with our hair on fire and say, well, we're firing everybody. That's not what we're saying here. What we're saying is we're going to make sure everybody makes the money they deserve, because I can tell you the comment you just told Commissioner Creasy, or the analogy, if I went to work at another company and they told me, well, Mr. Wandell, we'd like to hire you, but your 15 years of experience at the other place doesn't mean nothing here. We're a different company. And you're going to have to start out, $20,000 less. I would look at that company, and all due respect, I will never work here because I believe there's value in what I do. And if you don't see value in what I do, I wouldn't probably come to work. So I think there is value in Anderson County. I think we have a great county. I think we have a great things to offer. And I think if you were teaming up with HR, those things would be brought to light more. So I apologize, but I want you to know now, I'm going to be looking at other options. I'm going to evaluate. I'm going to weigh those options.
Sure.
There's no collusion. I'm not meeting with other ones on the side and cutting deals and, hey, we can do this. What I can do is I can look at what makes sense for the taxpayers of this county and see if we can save some money. Because at this point, I believe we can. You might disagree with that, and that's fine too. Thank you, Mr. Chairman.
Any other questions or comments? Commissioner White, would you like the opportunity? Oh, I'm sorry, I didn't see Commissioner Meade.
Yeah, I'm going to go back to something I've kind of said before, but not long ago, this commission hired and paid a special group $40,000 to come and take a look at how we're running our EMS. They took a bunch of time, put in a lot of effort, and they came across with some very specific recommendations, but the big picture was that for at least 6 years, our EMS service has been dramatically underfunded, not enough money for adequate staffing, not enough money for the equipment that's required under state law. And they also looked at the different systems that are possible. It basically said subcontracting EMS or something in a county put together like Anderson County simply would not work. And having a county-funded county system is actually the most economical way for us to have an adequate EMS service across the county. I'm worried that we're going to continue our philosophy and our policy of dramatically undercutting EMS with funding, with not enough funding, and then complaining that it isn't quite the way we want it to be. I think we have to step up and say, hey, look, these salaries are inadequate. They have to be brought in line with what's at least competitive. I think we have a great benefits package. I think that's an allure. That makes it a little better than maybe McDonald's in most cases. And I'm not trying to make fun of McDonald's just in case somebody from McDonald's is listening. Just a place that I frequent from time to time, so name comes up. So I think this commission, part of our responsibility is to make sure that EMS is adequately funded. I don't think we have a management issue. Every company has some things you could do differently. There are certain personalities that get into things, but I think that you're doing a particularly good job with what we've handed you. And I think that we've got an EMS service that I know when talking with other counties and talking with EMS people from other counties, most of them feel like Anderson County is almost an example of the kind of service they'd like to be able to give. But they're being dramatically underfunded, and it looks like we're continuing to do that. We've supplied a little bit of capital stuff that had been left in the background for a long time. We got a little bit more equipment. We still don't have as much as what we were told we needed to have by the audit team that we hired to give us that information. So I think we need to listen to the audit team, look back at it again, and decide that we have to fund the EMS to give adequate wages. And it looks like they need about 2 new ambulances a year, and we need to put that into our budget. And that's what we need to do if we want to really do our job. Otherwise, we're just making excuses and pushing it under the table. Thank you.
Anyone else? Thank you, Nathan.
Thank you, sir.
Commissioner White, you want to speak for a second or about any of this, or?
Not really. And I mean that. I really appreciate you people taking the time and listening. I think the Budget Committee, I think our goal is to bring to the full commission a budget that you can pass and support. I think that's our mission. So I appreciate Nathan, and I appreciate Tyler, and I appreciate everybody that's come this way tonight, but listen and digest all this information, and we'll go from there. Thank you.
Thank you. Sheriff Barker.
Well, I want to start off by saying, Tracy, I love you too.
I love you, Sheriff.
Hey, here's really the crux of it. We do absolutely appreciate the opportunity to come in front of operations and discuss this. As I said in budget, you guys have absolutely the worst job we have to offer right now in Anderson County. It's a tough decision. You're going to be very popular in some areas and very unpopular in others, and I wouldn't trade places with you for anything in the world. Tonight, we want to present what we believe are our needs. We completely 100% stand by that, and what I would ask you to do is to take a look at our request through the lens of 2 separate budgets, the jail and the operations side, but yet again, and I know I'm kind of speaking out of both sides of my mouth on this, but then I want you to look at what we've done overall to the budget and where we've made the cuts, where things are within our control, where we've cut them. I think you'll see that we've done our due diligence, and we've absolutely done the very best we can as far as that goes. But we're going to have Director Mays, he's the Director of Administrative Services, present this. The rest of the team that is with us is our interpretive dance team. We feel like that would be a little easier, keep your attention a little better. So please, if you have any questions, we look forward to them and welcome.
Thank you.
Mr. Chairman, well,
Yes.
and maybe I missed it. Was it in the budget? Do we have the sheriff's budget? Was it in the package?
No.
Okay. Go ahead.
Thank you, Mr. Chairman. I had sent the budget out. I apologize you don't have it.
I have missed it.
Yeah. It's hard to follow Sheriff Barker with his wit, and I get to talk about the boring stuff. And what Lieutenant Sharp has there, we'll talk about throughout the process. I want to dive in and talk about a couple of budgets that are not, I think, that are worth talking about, but Of course, the two elephants in the room will be our operations and our detention facility. But if you first, I'd like to talk about our alternatives to incarceration. This is a department that this committee or this commission birthed. We have a lot of faith in this committee or in that committee and in that program. Director Young does an amazing job. We met with Director Young and we talked about these cuts because we looked at the historical data and felt that it was necessary to make these. Majority of the funding that we cut was in contracted services with PSI. PSI does the ankle monitoring. They contract with the county to get inmates out of jail who are nonviolent, misdemeanor type of offenders. Just an example of where we were at a few weeks ago before we presented the budget, we gave Mr. McNabb 149 names that we thought potentially could qualify. And there's a lot of parties involved with the judges, the DAs, public defenders, et cetera. We came up with 3 names that qualified. And so we're seeing a reoccurring theme. The people that we're locking up are your more violent felon offenders. It's not in Chad's business interest to see a cut, but we met with Chad as well, and the number that we arrived at is something that we mutually thought would be in the best interest of this budget. So those are things in our control, and we wanted to make a cut there because we don't want to build fluff. We don't want to have waste. So we made a cut in that department. Another sizable cut that you'll see is a decrease in dispatching. One of the things that we felt like in dispatch, our salary code was a little heavy. We have seen an increase in overtime. We made that adjustment using historical data, but we made a cut in our salaries because historically there's always money left over. We felt like that we wanted an open and honest budget. And I'll tell you that one of the things that we did in dispatch to help with overtime, because a lot of times when you're working an insane amount of overtime, that causes burnout. And then that also causes turnover. And what we have done to try to mitigate the increase in overtime and those issues is Lieutenant Sharp decreased the hours, the shift from 12 to 8. Initially wasn't the most popular decision, I think, with some of the employees, but it has streamlined efficiency in our department. And I think that you see a more refreshed employee in that unit. So those collectively, about $146,000 in cuts that we made in those 2 areas. Because again, the sheriff is responsible for 4 budgets. The drug fund and commissary, there were no changes, so I didn't bring those up. So now really, I just want to go ahead and jump into the 2 biggies. Budget committee has been very gracious to us to allow us to share a lot of this throughout the 6 months that we've been in office. Our first request is in the operations budget, and it will be a total increase of $399,696. That is requesting 5 positions in operations. 1 would be a school resource officer, and the other 4 would be patrol. To touch briefly on the school resource officer, we believe, as you can see, Governor Lee has just signed, I believe has signed the bill now about adding a resource officer in every school. Now, there's some language in that bill that I don't know if we will be too fruitful on this fiscal year because they're trying to get in the rural areas where there are no SROs in schools. But we are going to try to obtain funding from the state to help in that regard. We see schools like in Commissioner Wandell's district, Claxton Elementary School is a very large elementary school. We believe like that school needs a full-time SRO. Our calls for service in Claxton have increased dramatically. The population in Claxton in that school has increased. Those are things that we've identified, and we would work with the school system as well to place that individual if approved. In terms of the 4 other, where we arrived at these numbers is that our calls for service and mental health transports have increased a lot over the course of time. Now, and two, just some small housekeeping things. The big part of the increase is that we looked at all 5 of those positions having a family and selecting our gold plan. That doesn't always happen. Matter of fact, most of our employees choose silver, and they don't have the family plan. But it would just be our luck that if this committee and this commission passes our budget, and we didn't put that in there, they would all have 6 kids and want the gold plan, and we would be underfunded. And so we really wanted to shoot high there, and then whatever's excess, we give back to the county. So I just wanted to address that. But I'd like to first talk about our calls for service. Going back to 2014, our calls for service were 25,147. Now, if you look at 2019, what we are projecting, again, as I told the Budget Committee, this is a low-end projection because we were using our winter months to make this projection. We're looking at 32,477 calls for this year. Now, that's about 89 calls a day. I went over to dispatch at 4:41 this afternoon, and we were sitting at 85 already. As I'm sitting here next to Sheriff Barker, we had 3 domestic in progress, 2 with injury, and we had a motor vehicle accident. That is our day. That is, in that snapshot that I'm talking about was at this current moment, not the course of the day, but as we're speaking today, we have that going across our county. And you can't just send one officer to these domestics, especially with one where there's injuries involved and potential weapons and et cetera. But so you'll see that we've had an increase in calls by 7,000. And I do project that number to be higher, but I wanted to be a little conservative there, but just for discussion. Now, when we talk about mental health transports, this is the biggie for us. Mental health transports have really placed a burden on our department significantly. Matter of fact, today, before we left today, we get a call that we need to transport a juvenile to Memphis. That requires 2 officers to go on due to the duration of the travel. Well, we've got calls going out, transportation's booked, we've got trainings, et cetera. We scrambled. We did find 2 officers to be able to take that individual to Memphis in the morning. But when we look at it, in 2018, we did 520 mental health transports, totaling 1,426 hours that we were working on those. In terms of mileage, our officers drove 85,996 miles last year just to transport mental health people from the hospital. Now, to give you some background, if you're not aware of what the mental health transport requirements are of the sheriff's office, when an individual goes to Methodist Medical Center and they are deemed to be needed to transport to a mental institution, Moccasin Bend in Chattanooga, Peninsula, all across the state, it is the responsibility of the sheriff to make that transportation happen. We see a lot of out-of-county folks use Methodist Medical Center. Morgan, Roane, Scott, Campbell, Union, a lot of them use. So a conservative estimate would be about 40% of the people we transport are not Anderson County citizens. But under statute, we are required to transport these individuals. Just to give you an example of where we were at in 2018, Salina, Chattanooga, Cookeville, Franklin, Greenville, Jackson, Jasper, Johnson City. The good ones are in Knoxville and La Follette. When those come, those are not that hard to find to cover. Livingston, Louisville, Memphis, Murfreesboro, and Nashville. Our probably most common area is going to be Chattanooga. But we get these at times, I've seen as many as 7 in the CAD holding. That has placed an immense burden on our department. Now, Sheriff Barker, members of the Sheriff's Association, has worked with legislators on trying to ease the pain. We do not get reimbursed as well for these. The only county in the state of Tennessee that reimburses us for any kind of mental health transport is Henry County. And Budget Committee passed the $96 that they gave us We'll take what we can get, but that's the only county that does. There are no requirements under state law to reimburse us for that. So that is another pressure. The other thing, and I draw your attention to the map, for the last decade, we've been operating on 4 patrol zones. The county is divided up, and it's not based on population, but calls of service, divided up into 4 zones. As you can see, Zone 4 looks, this is our proposed zones. Zone 4 now would be, Commissioner Isbell, your district, as well as part of Commissioner McCamey's district. It is geographically large. It's monstrous. We'll have an employee working a wreck at Old Tacora Hills. He may get a phone call on New River Highway. There's one way in and one way out. No side roads, no back roads that he can take or she can take. A lot of times they're traveling through Morgan County just to get there to the call. That's the fastest way to get there. So what we've looked at based on our calls for service and areas is we've divided the zones up into 6. One of the things that we've heard throughout the campaign and being in office, and from commissioners who've shared this with us, is particularly in New River, in those areas, they would like to see patrol cars more. We would love to be able to offer those things. Unfortunately, the calls for service and our manpower kind of make us go in different areas. These zones allow us quicker response times and also more of a presence in the counties and the citizens we serve. If you look at the Zone 2 car, a lot of the things that we do, it looks pretty large, and Oak Ridge is included in that. What a lot of people don't realize is that we are the only canine unit in Anderson County. So if Oak Ridge needs a canine search, they call Anderson County, Clinton, Rocky Top, Norris, etc. So we touch all of these areas. So that Zone 2 car, for an example, right now, you've got one car looking at about 29,000 residents. It's a lot for them to cover. Our county, and as you all know, through campaigning and knocking on doors, geographically is large. And it's hard to get from point A to point B sometimes. And right now our manpower, when we have military leaves or vacations or employees calling sick, like for an example tonight, with the current calls of service, we're one employee from getting the flu away from really being in a bad spot. And just as a side note, Chief Galloway has done a great job. We've done a lot of reorganization within the department, with some cuts and some shifting employees. We wear a lot of hats in our department. Myself and everyone that you see behind us, we have one title, but we have a lot of responsibilities, and that is so we can get more feet on the ground for the citizens. He's created what they call a mid-shift that work 2 to 10 to try to cover our busiest areas. That has helped tremendously, but we still have a need for these positions. And what this also will do is it allow us to be proactive police officers in a proactive department. A lot of times we're reacting to things, but if we can do burglary patrol, getting out in the community, stopping in driveways, and that is our best resource, are these people. Right now we're just going call to call, but we really, and Sheriff Barker campaigned on it heavily, we want to be active in our community. And this will allow us to do that. In terms of filling these positions, I've been asked a lot about that. Director McBroom, Greg McBroom here, he and HR are working together. We have some job fairs lined up. We have one at Pellissippi State Community College coming up in May. I think it's important. HR is a resource where we can talk about the stuff such as zones and equipment and those things. Well, having Kim or Stephanie there or Drew to talk about, the benefits that we offer and some of the extra things that we have to offer. They get the piece of the pie while we're there. So that's something that we have lined up with HR coming up, I think that will be beneficial to us. We constantly keep applications coming in for opportunities. That's just something that we believe in. That way, if we ever are in a need, that it's there. Any questions about our operations budget? I'll try to keep it quick. I'd like to jump into the detention facility. I know that's a lot to absorb, but yes,
Mr.
sir.
Creasy.
Yeah, what is your entry level starting pay?
For a police officer, so they will start out at $15.17 an hour. After 6 months, and they successfully complete their training, field training, then they will go to, I believe, depending on their experience. Some officers come here from other agencies. If it's a fresh out of the academy officer, they'll go to $17.13. If they have experience under civil service, we do have some we have some room to count their experience, and we do. They may start at $17.88 or whatever the number is we arrive at, but they will jump after a probationary period.
Thank you.
Yes, sir.
Commissioner Anderson?
Do the patrolmen in the zones, do they stay in the same zone for a long period of time? Do you have a rotation or anything?
I would, if with your permission, I'd like to defer to Chief Galloway. He can better answer that question.
Thank you. It's primary the supervisor's decision. We have some supervisors that like to keep their guys in a certain zone for a whole rotation, and then we have a couple, I think, that like to rotate nightly or daily for the officers to go to different zones. But it's really the supervisor's discretion, and they try to base that on what their shift like. And also, one correction, I think Clinton does have one canine.
Okay.
Yes.
I was just trying to give us all the credit. I'm sorry, Chief Becker.
Hold on a second. Commissioner Yeager, you got it.
When you're finished with that.
Yeah, I was just going to add to Commissioner Anderson, one of our canine officers, James Presson, he has befriended a resident in Brushy Valley, on your end of Brushy Valley, an older lady. I can't remember her age. But by doing community policing, by going out, going to her, seeing her out, stopping, he has now taken her with his grandmother to the firing range. She's now got a license to carry. She'll call him, hey, I'm going on vacation to see my daughter. Can you give me some extra patrol? So those are the things. They like to stay in zones sometimes because of those, particular incidents.
Commissioner Yeager?
Thank you. The 6-zone map, are those dispersed equally, or, did you do it by call?
Yeah, what we did, it really all of us did it. We're actually glad to present it to other people because we're about to drive each other crazy with some of this. But we met as a group. Lieutenant Sharp and Chief Galloway have really, this is their expertise. It's really looked at by calls for service. If you look at some of them, you'll think, well, that looks like a small zone, and I don't have it in front of me, but the East Wolf Valley, that corridor there, you see a lot of calls for service. So you'll see a smaller area because of response times. We also looked at, if they're getting a call, if they're here, and then they get a call over there, what is the time frame of getting there? So calls for service, geographical size were really the determining factors in splitting these zones up.
I did have one more. I apologize. I was writing down a question when you were talking about the 8-hour shifts. Is that just the middle of the day fill guys, or are you looking to run everybody at 8-hour shifts?
Well, dispatch went to 8-hour shifts. It is 2 to midnight. I apologize on the mid shift. That is they work 4 10s.
Okay.
On the mid shift, so it wouldn't be an 8-hour shift. It's a 10-hour shift.
Okay.
Our standard shift worker officer is a 12-hour shift, but our mid shift, which we have currently 3, they are on a 10-hour shift, and they work, do 4 10s.
Okay, thanks.
Mm-hmm.
Commissioner Wonder.
Thank you, Mr. Chairman. So Tyler, so far, what I think I've heard you say is 399,000 roughly is an increase request.
Yes.
For 5 positions, and that's on the operations side.
That is correct.
Okay. And you're getting ready to tell us more.
I am.
Okay. No, it's okay.
Yes.
But do you happen to know, and it's not your job, I realize this is obviously a new administration, and I think you guys are doing a great job, and the ladies. Do you know what the budget was last year?
The budget last year was...
Again, not your budget, okay?
Right, no. Mr. Chairman, I apologize, I don't have it in front of me.
It's okay.
Yeah.
I should know it, okay?
Well, roughly 5.8 million, I
Okay,
believe.
we'll just use it as a guess.
Yeah.
No problem. All right, thank you. And what's your total request this year? I know you're going to get to it, or would you
It's
rather?
about 6.1, roughly.
Okay. And that's already taken in conjunction, or in account, rather, the savings you've.
It's not. These are just the increase. It's like I tell my wife when I go out and buy something really expensive, I said, well, I saved this on this over here, trying to justify my expense. But we do have a cuts of $146,000. That's just the $399 I was referring to. It's just a straight request. In essence, if we're just keeping a tally mark, we're looking at, let's see, $245,000 at this point would be the increase if you take in the other departments into consideration. So,
And I think I heard you say, if you don't spend all those, expend rather, those funds, you would return them back to the county.
yeah.
If they're there.
If they're there. I mean, our intent is to fill the positions that we need. Any excess money, of course, would go back. You know, we talked about in budget this past week, I'm not a huge fan of touching salaries to go to operational line items. That really is a reflection. Now, in this situation, it's a little different. It's an unpredictable code, but it's a reflection on us as managers too, if we don't appropriate enough money in those line items. So I literally like to stay away from those if we can.
Thanks for answering my questions. I didn't mean to interrupt you. Thank you, Mr.
Absolutely.
Chairman.
Yes, sir.
Appreciate it.
Any other questions before he comes out of operations into his budget? Now, the one thing and you're probably going to take this up, the overall increase would be?
The overall increase is just a hair over, if we're not taking the other two budgets into consideration, it's slightly over, under 1.5 million. So it's about $1,400,000 some change.
Okay.
Again, I like to throw in the $146,000 savings. It just makes it look better. Yeah.
I understand. Continue.
Yes. This one is fairly cut and dry. This is Unit 1. This is where the increase is not to make any changes other than to open up Unit 1 at the jail. As some of you are aware, most of you may be aware, we are seeing a dramatic increase in our population. That is a direct result of the aggressive work that the Sheriff's Department, Oak Ridge, Clinton Police, Rocky Top, Norris, of the work that they're doing. We are putting in a lot of bad people. A lot of people are getting convicted. This morning, I haven't seen an update since this morning, we have a 435 bed unit open. We had 451 prisoners. So that right there is a large number. Under TCI standards, we need to be at 370. 370 is considered full. We are dramatically over that. Some say we'll take back Ray County. Well, we take back Ray County, the county loses $30,000 a month, and we're still way overcrowded under TCI standards, which this county's been through it before in terms of the jail certifications, et cetera. Before I get into it too, we've seen a large increase in state prisoners. The problem is that the state prisons are in the same boat that we're in. Almost every prison, with the exception, I believe, of Riverbend, is near max capacity. A lot of the beds that are open are for people who kill people or are really violent offenders. Well, we've got a guy here that maybe have a 5-year sentence because he sold, drugs. They're not going to put him in a maximum facility at Riverbend. We asked for 10 beds a few weeks ago. They gave us 3. The flip side with having a large increase in the state prisoners is that our revenue has increased. This county appropriated $1.7 million for revenue for prison boarding. Projection is probably going to be about $300,000 to the positive. Not that that's something to brag about, because it's a result of bad people doing bad things going on in your county, but there is something tied to it. There's nothing we can do about the state prisoner population. We ask, they give us what we can give. Sometimes they don't give us anything when we ask, because they're in the same boat as we are. It's out of our control. So what happens is that with our 435 bed population, we have segregated units. We have a medical unit. The only people out in that unit are people that suffer a medical condition. We have sex offenders. The law says we got to keep them separated from population. So we have these segregated units. So some say, well, you've got 16 sleep on the floor. No, that's really not the case. We have a lot more than that, because certain units are full where people are classified. That's something that we, and we're not getting much, we will not get leniency from the state, because we have a facility that holds 128 beds that's ready to be used. All it's missing is staffing. And that's where we're at today. I wish there was a plan B, but there's not. It's either we open unit 1 or we don't, and we just have to figure out where we go from there. Unit 1 would open up 128 beds, which is designed for minimum security. To open it up, and again, what we're asking for is a bare minimum, just to get us where we need to be, is 12 correctional officers to open up that unit. That would be 3 shifts. Is that correct, Chief? 4 shifts. Sorry, 4 shifts. You'd have 1 in each unit, and you'd have 1 running central command. Our pay for new officers starting at the jail is $13.72 an hour. It will bump up to. I'm sorry.
Yeah, it's entry level for the.
It's $13.72.
$13.72.
Yeah, and once they complete training in 6 months, they'll go to $15.17. These positions, of course, drive the big bulk of this increase with medical costs. Again, we factored in these folks having kids and asking for the gold plan, the gold dental plan, et cetera, just so we don't, undersell this. We've also increased our utilities, our custodial supplies, and those things. By nature, those will increase because of the new unit. You'll see electrical go up as it's currently, the lights are not on, but that's where the increase is. What you also will see in this budget is an increase in our medical contract. For years, we have had a contract operating at an average daily population, I believe, at 350, correct, Chief? We haven't been at 350 in some time. Matter of fact, this commission approved a new contract for us back in February with Southern Medical at an inmate population at 400. As you know, that we're not there anymore. This new budget has an increased request at 425. We're right now at 451, but again, those numbers do fluctuate, but we're staying around that 425-ish range. That's what this budget reflects. In addition to, when you arrest them and put them in jail, you got to feed them. We have to feed them, and so I have increased that line item as well. We're seeing, that's another thing that's hitting us on this year's budget, again, that we inherited, is that we're seeing a large uptick in having to feed these folks because there's a lot more of them than we anticipated. Our medical claims line item also, you see a substantial increase there. I can't answer to why for the last several years that line item has never been adjusted. It has never met the $300,000 mark that it has been budgeted for years. I worked with Director Erb on this to come up with a number that we felt was more accurate, which was a $60,000 increase there, because that coupled with our new medical company in there with more presence and better services, we're hoping to see that less hospital stays, et cetera. Again, the unfortunate part about that line item, it is completely unpredictable. It's like being blindfolded and putting a tail on a donkey. You don't. We had a guy that was in the hospital for 2 months. 6 of those weeks were served in CCU due to a bypass surgery. That's just something we can't control, but at the very least, we wanted to make a good faith effort with this committee, with the budget, and with commission and the taxpayers to try to get as close as we can. Because really, ideally, we don't like to come before a budget committee all the time. I love the committee members, but the idea is not to constantly have budget amendments. The idea is to try to operate with what you predicted and what you think is best. Again, a question that was asked about staffing the jail. We all know that staffing at the jail has always been a question mark simply because the work, we go through it there all the time. The work is absolutely tough. I can't fathom the work that they do. Sometimes they don't get breaks. They don't see all they see is orange jumpsuits, a bunch of screaming. And so we do see some turnover there. So how do we fill those spots if the commission approves this budget? Again, we are working very closely with HR to recruit these folks, people who have a desire to get into law enforcement at colleges, people that have come across their desk at HR that we may not have gotten to talk to, but folks that we feel like if they get the total package at that meeting, we've got a better chance to maybe get them into the door and talk to them. So that's something that Director McBroom, again, along with Lieutenant Val, will be working with HR. Again, even if this committee just decides not to go in that direction, we like to have a good qualified pool of candidates to select from any time we have openings. That's the gist of that increase. Again, I would like to also just leave you with one last thing, is that we recently, I think Commission got this forwarded to them by Mayor Frank or maybe Commissioner Wandell, was our initial inspection at the jail. There were some cosmetic things that have already been addressed. The one thing that, again, that this state inspectors group recommended, and it's at the very last page, is that we open Unit 1 along with the additional needed correction officers to operate the facilities, because again, we've got inmates in the bed, and I mean, not sleeping in beds, they're in the floor. So that's coming from the state of Tennessee. That was that was their recommendation at the end of their inspection. I will entertain any questions you all might have.
Commissioner Yeager.
Thank you. Nice presentation, Tyler.
Thank you.
The jail is budgeted, the request is for a $1.2 million. I know you guys don't get credit for the revenue that's brought in.
Correct.
But how much in revenue do you expect that to bring in by opening?
So Unit 1 at this point, it really is to address our current issues. So there you wouldn't probably see an increase in our current trend. Again, I think that the current trend right now is probably about $250,000 to $300,000 more than what was initially projected. Again, that unit, again, we're not going to fill Unit 1. There's 128 beds, so there's other avenues. We were looking currently at a grant, looking at for the mental health needs that are in this community. Of course, that would potentially be a revenue stream for this county, but also provide a much needed service in Anderson County, working with Ridgeview, Mobile Crisis, and those units. And it'd be unique to this area. Again, unless we see an uptick in Rhea County or state inmates, there's not necessarily a revenue stream that would be added to that.
If I may interrupt for just a moment, but the question you specifically answered, we're not doing it to increase revenue, okay? But LT, would you move that? Or you guys, done with the map?
We're done with the map.
Okay. It's not to increase revenue, but the potential is there. We constantly have counties who are reaching out to us because every county has a overcrowding issue. The beautiful thing about Anderson County is you guys built a facility years ago, and now it's just time to get us there. So we're prepared for this. I do know that Hamlin County has reached out to us, and they're offering a much higher rate than the $38 a day that the state currently pays. Now, it becomes a little bit of a slippery slope because one, we need them. We need these beds for our own population. But as word gets out, the state will be trying to claim some of those beds as well. All right. So that would probably increase revenue to a degree. But ideally, what we want to do is get this where we have our classification, and we can manage that. If the opportunity presents itself to increase the revenue through additional Rhea County inmates or Hamlin County, whoever it may be, we are definitely open to that because one, we want to be good neighbors, and two, anytime we can help offset the costs, we absolutely want to do that. Back to what he's talking about, we have began the works where we have applied for a investigation or grant that will, a planning grant to look at, to address some of the other things, because one of the big things that we're wanting to do when we talk about getting out in the community and being engaged, we're looking at reducing recidivism. And part of that we're talking about is narcotics related and mental health issues. So we've got a team together that we've put that we've worked with that. Stephanie with ASAP is actually helping us on that grant on the front end. ASAP's one of our community partners in that. And that grant will be placed out there so that we can see basically what we can do. And that may put part of Unit 1 in play, depending on what our population is. But at the end of the day, Unit 1 currently, as we stand here tonight, is absolutely necessary. It's going to reduce our liability. It's going to just allow us to not worry about lawsuits, people being laying on the floor, things of that nature. But to kind of circle back to your question, we're not projecting or counting that as part of our ask for this need, but it absolutely is there in my opinion.
Thanks.
Mr. Anderson.
Are the 128 beds, I know you said it was minimum security, are they all classified as the same thing, or is that part of those medical, or?
I believe they're all the same as that. Yeah, it's an all open dormitory.
Okay.
Now they're split up into two sections, 64 on one side, and then there's, divider, and then 64 on the other.
Okay, and then I think you'd mentioned in the budget meeting that as far as like Rhea County inmates and stuff, we don't have to pay their medical expenses or anything like that. That they go back to Rhea County.
Yeah, and if the beautiful thing with Rhea County, if one of them's causing us problems, what we get is weird to say this, the best of the word, I guess, at Rhea County. They cause us any issues, Chief Parker gets on the phone and they're going right back to Rhea County. So we're getting, in terms of, you're getting the best deal you can get from that county with that inmate population, but no, we don't.
Okay.
To answer your question.
So with the state rate or whatever, I mean, we can't necessarily say no to the state, but what we get from them doesn't necessarily cover the cost, but we can negotiate with the counties. And
yeah, so the counties that we partner, if we partner with, for an example, like the sheriff said, Hamlin, on the front end, it would be an agreed upon contractual rate of what they would pay per inmate per day. Again, like Rhea County, like I said, we're getting about $30,000 a month, and it's pretty like clockwork. We get the check from them. So it'd be something similar to that, I would imagine.
Thank you.
Commissioner Meade?
Yeah, one of the things that's concerned me for a long time, and it always seems to be kind of brushed aside, is we get with these state prisoners. I know we don't have a whole lot of choice, okay? But my understanding is that the state pays $38 a day, and it costs us at least $60 a day to keep them there. Okay, so that means we lose $22 a day per prisoner. For 100 prisoners, we got more than that. That's over $800,000 a year that we lose, that we have to spend extra because of 100 state prisoners. The state is ripping us off, and it's costing our taxpayers close to $1 million a year because we have those state prisoners that we are forced to keep.
You're exactly right. The state of Tennessee some time ago got out of the business of building more prisons and pushed that down to the county level, and this is the exact result of that. They're not building more state facilities. They're cutting us a sweetheart deal at $38 a day, and we get to keep them. And you're exactly right. That is right on, and that is completely out of our control.
Commissioner Wandell?
Well, follow up on that, Sheriff. So if we open up these 128 beds, what happens when they say there's 128 more state
Then we'll
prisoners?
get 200 state prisoners.
Well, that's my question, yes.
Yeah.
So my position on that is this. They very well may try to claim some of those beds, and they may, because one of the things is with our, and Chief Parker, if you could clarify this for me, the state inmates we have are our own local homegrown folks who have been convicted for the most part. And what it would be is they would not send them on to a state facility. Again, Unit 1 is 128 beds designed for minimum nonviolent inmates. So that would be very helpful in that sense.
Okay, so what I'm hearing is for the 1.4, roughly 1.5 million requested increase in the budget, it's going to be 17 new employees. You open up
yes,
to
that's correct.
128 beds, and then you've broken it down already. 12 correctional officers, 4 patrol officers, 1 SRO. I just want to go ahead and ask us while we can, so we can, you know how it happens, right? We pass a budget regardless of what that number is, and then all of a sudden you have new uniforms, you have new cars, and people start saying, oh, you took all that money and just went out and got new toys.
Right.
Is that the purpose of this budget?
No. Those are items in our line. I mean, those are line items that are already included in this budget. Anything more than what we've already budgeted for would have to come before this body or before the budget committee anyway.
So if there is new vehicles, and look, I'm not disputing you need new vehicles. I'm just,
right.
You know, as a commissioner, that's the stuff we get to hear.
Exactly.
So if those things happen, it's already in the budget, and they would have been happening anyway, even if we didn't give you the 1.4.
That is correct.
Okay, thank you. I appreciate the presentation. Sheriff had something to add.
I just want to go ahead and tell you guys this. With the budget that we inherited, we are changing uniforms, and we've already done it. And we were fortunate enough to have some money, and we bought some new new to us Missouri cars. So you're exactly right. I can completely see why you're going to get that. I'm going to go ahead and tell you, whether you pass it or not, you're going to see us in green uniforms and newer cars.
Well, I mean, that's...
But it's absolutely done in this particular budget.
I appreciate you bringing it to people's attention, so, you know, we can kind of move on past that. I mean, you know what I mean? I mean, I think it's important that, look, Nathan comes in here with new uniforms on, and I don't criticize him on that. I mean, that's his bit. He runs that piece, but you got to afford it, and sounds like you have it in your budget to afford it, so...
And that's what I would like to just make a special note is from day one, we've really made a concentrated effort to operate in the confines of the budget that we inherited. Now, the 507 code in medical and the detention facility is really, it's the most unpredictable code in Anderson County. Excluding that, we've made some transfers. And another thing, a lot of the capital projects that we didn't bring before the commission, we have the benefit of having a drug fund. So instead of coming before the body and asking for money to upgrade an evidence building, et cetera, we used our drug fund money to upgrade these capital projects that are much, much needed in this county. But again, that's money that has been obtained by seizures and things of those nature. We really, and sometimes it's hard sometimes to tell a chief no on spending, but you know, we're very adamant about operating on what we've inherited, and again, whatever is appropriated by this commission.
Let me ask one last question. It's my understanding that the budget from last year, there was roughly $3+ million turned back in to the county. And for me for me, I go, well, $3 million was turned in last year. We're asking for another 1.4 this year. That's a $4.4 million increase, you see. Now, I'd like for you guys to kind of tell me from your perception, again, it wasn't your budget, you didn't control it, you didn't manage it, but could you tell us what?
Yeah, with all due respect, Mr. Chairman, I'm not sure where that $3 million comes in. Talking to Ms. Erb, it's roughly the administration would turn in just between $400,000 and $500,000 in excess money.
Okay.
I don't know if that's a countywide number, but our number between $400,000 and $500,000.
Okay, so that number I probably misinterpreted myself.
I'm not sure.
No, it's okay. I'm just
so
trying to clear things up so when we get on down the road here, we don't.
Where that money's at, when this commission approved raises for the sheriff's department, that excess money that got turned over was always coming from a salary code. That now is turned into raises for the employees before we came into office. So by nature, had Chief Lucas been elected or whoever the sheriff may have been, that money was gone. That excess money was never going to be turned back into this county.
Well, Mr. Chairman, I just want to set the record straight then. There was never $3 million turned back in the way I understand it. So I just want to let the folks at home understand that, because I think there's a perception out there that the last administration turned in $3 million. Now the new administration is coming in asking for another 1.5 or 1.4, and I had a lot of questions about that. So I appreciate you clearing that up.
I appreciate you bringing that up, because if that is out there, if we had that kind of fluff, we actually would have probably been the only sheriff's department in history asked for a substantial decrease in funding, because if there was $3.5 million left over, we would have, you know, my buttons wouldn't be popping off this. That's more of a McDonald's issue.
Commissioner Wandell, and that's why this meeting tonight is very beneficial for the folks at home that can actually hear the things and dispel some of the rumors.
Right.
Yeah. Thank you for your comments.
I appreciate it, Mr. Chairman. I appreciate Chairman White, the Budget Committee, bringing it up, and I appreciate everybody presenting.
Yeah, we really appreciate that.
Commissioner
I just want to finalize my comment here and ride on what you and Tracy have said. The people at home are able to see what professionals we have in law enforcement, what a great job the sheriff has done in bringing a professional staff together, and everyone gets to see that and hear them. I think it's been a very good meeting.
Thank you very much.
Thank you so much.
The question that I've got, and you were talking about, when you just talking about Mosque and Bend, now
Yes.
that's a mental institution. So if we're able to open one, we won't be transporting the Mosque and Bend and all that? Or
No, I don't.
we still
Yeah.
will?
It's really fluid. Couple things that we talked about was dealing with, again, lowering recidivism. My guess is, and I have no idea what the national numbers are going to say, but 90 to 95% of all crime, in my humble opinion, is driven by narcotics. A problem of that as well is mental illness. We all remember back in the day when Lakeshore was open and running. We don't have it. As a country, we've done a really poor job of taking care of our people who have mental health issues. So it's a very complex, complicated situation that we're talking about. But the two things that we've identified the most from a law enforcement perspective is mental health and addiction. So with this planning grant that we have, if we're selected for it, it allows us to put together a team to look at what we could do that would fit for Anderson County to address some of these issues. It doesn't mean that, and once we identify that, and if we're selected, we're allowed to apply for additional grants. So this is a really long, most likely a multi-year process that we're in. The really neat thing though is it's going to, if we get this grant, it's going to give us an opportunity to bring a lot of different disciplines to the table and see what is our best direction. And the outcome of that will not be stopping these mental health transports. Absolutely not. But it will get some folks who are incarcerated, mental health treatment, and hopefully as well as narcotics treatment. Because, I attend Grace Baptist Church, but I can promise you that the absolute closest I was to the Lord in my life was 12 weeks down at Paris Island boot camp. I was trapped and nowhere to go. And that's kind of the same effect that the jail has on you. When you're there and you're locked in, that's when you're most open to change. And we believe that's a great point of attack to truly reduce recidivism. But some of the things that we're also, not to get too much down the road, but one of the things we're looking at too is we're talking about aftercare, finding community partners to follow them all the way through. Some of our factories tell us, and our industry here in Anderson County, they have a hard time filling jobs because people can't pass a drug test. We want to walk these folks down that path and say, today they are clean, they've completed these programs. We believe if you were going to gamble on one, this would be a good one. And kind of walk with it. That's what we're hoping to do anyway.
But one of the good things out of this is we're not talking about a jail expansion.
No, sir.
Is that we're actually, where we have pre-planned years ago that we really got raked over the coals for us having an empty building. We're not faced with that situation, but it'd be several $1 million for that expansion. And it's always been, I always, in public, especially on the talk show, what about that empty building that we built over there and spent several $1 million? So I applaud you for taking the initiative to get that thing going.
Chairman Isbell, I'm going to be honest with you. When we just got back from the Tennessee Sheriff's Association. Among the other topics is overcrowding jails. And you want to talk about being the envy of the party. When I stood up and said, we've got 128 beds. Yeah. Now we're talking about opening. Because the rest of these, everything you're talking about, and I'm sure for those of you who were on this commission and remember the pain of having to justify and decide whether we're going to do it or not. That's what everybody else is doing. So we're incredibly proud and incredibly grateful that we have that. And so the rest is kind of in your court, so to speak. Again, I don't envy you guys because this is a big undertaking that you're this time of year in general, and we look forward to helping in any way we can. If we can answer any questions, don't hesitate to contact any of our staff. And I will tell you this, Dr. Smallridge at Budget said, could you prioritize between the two? Because I'm sure that will be a question I'll get from someone sometime. And I'm going to be really frank with you. Please don't make me pick between my two kids.
Any other questions? Thanks, Sheriff. Appreciate your crew and everything that you do for us. Let's take a 5-minute break.
Make it 5 more minutes.
I gotta get some more water.
Get you one.
I'll leave it at that.
You know we love you.
Oh, well, thank you, thank you. Thank you.
I'm sorry, Mr.
It's-
Go ahead.
It's my pleasure to talk to you a little bit about what's going on with the health department. We looked at our health department budget and looked at ways that we could save some money. We had some positions that were not filled. We are not, so we're going to do away with those positions because I've been able to get some state positions back in to help cover more areas. And now that we're doing electronic medical records, you know, we don't have as much need for as many clerical folks, even though we have to have them there because they all have to learn the computers and all that. But we're able to speed up the clinic process, and our nurses are doing a lot more. The state has provided us with another nurse practitioner, so we have 2 on staff now, and we're able to do a lot more with primary care and family planning services. So I was able to reduce our local budget from the funds from Anderson County. I reduced that budget from about $20,000. Now, Natalie said that may be a little too much depending on the cost of the insurance benefits. And so she suggested that we put a little bit more back in there. But we're still less than last year for the health department budget. Where I'm asking for an increase is in the dental program. I'm asking for $31,000 more, and that is to pay for a full-time dentist. Right, for the last 4 years since Dr. Salage left, we've been using part-time dentists. It's very difficult to get. They're very, you know, most have their own practices or they're wanting full-time practices. So, but we've been very fortunate to have those part-time dentists. I'm losing 2 of them. One tomorrow is her last day, and the other lady left a couple of months ago. So right now I'm down to 1 dentist who's working every Friday and every other Thursday. But with those 3 dentists, we've been able to generate approximately $190,000 in revenue. And I feel like that's very good because that's about $1,600 a day in revenue and that's 108 days of having a dentist working. But that leaves so many days a week, 2 to 3 days a week without a dentist there. People are lined up at the door. You know, when we do have a dentist, it's just really becoming a problem because I just can't get everyone in. So we have advertised for more dentists. For part-time, we're not having any luck. So I really feel like that what I would like to do is to hire a full-time dentist, either 4 days or 5 days, whatever they would prefer. We have the part-time. If they want 4 days, we can continue using the other part-time dentist on the 5th day. If they want 5 days, then we'll just have to go with the new dentist 5 days, even though the dentist that we have has saved us a lot. And so maybe we'll be able to work something out to at least continue because when we go into the schools, and we're now in all 3 school systems, we need more than 1 dentist to go in and do those screenings because they're screening hundreds of kids a day with that. And we've been so pleased to be able to go into Oak Ridge these last 2 years. And so we go into the schools and do those screenings. And then if those kids, if we find problems and they do not have a dentist, then they are transported to the health department. And we set up days for just to see those kids and take care of them, whether they have TennCare or no insurance. If they have private insurance, then of course they usually have a dentist. For those that do not have any insurance, we do not charge them. For the TennCare, we do bill TennCare. We get and we get reimbursement from that. We are still one of the few dental clinics in any of the health departments in the region that see adults more than just for pain relief. So it's about 50-50 that we're seeing, 50% kids, 50% adults. Now, we also have the Emory Valley Dental Clinic, which is the volunteer clinic. And though, of course, the only cost there is a small salary cost and our supplies. And then, of course, the county is gracious to allow us to have that space in the Dickens building, and then we continue, upkeep our equipment, replace anything that we can. We've got both clinics in fantastic shape. What really used to help us with the Emory Valley Clinic was receiving the funds from the United Way. And, we lost that after last year. And they used to fund us up to $30,000. And now, because they said that we're not a 501c3, they cannot provide us any more funding. It's sad, and I know the county is providing them a place to have their office space and all that. I hope that someday we can get something started back with that, because that was a great help. And it was a model program. They always, showed us off when they were recruiting people to volunteer and things like that. But I'm so proud to have Dr. Rainey with me, and I appreciate him staying with me tonight. Dr. Joe Rainey is our Board of Health Chair, and of course also a dentist. And he has been trying to help us recruit some dentists. And so, Joe, if you'd like to come up, I wanted Joe to just kind of explain what a dentist coming out of school is getting now, like that. And I appreciate you, sir.
For those of you that you don't know me, I've practiced in Clinton for 47 years and have been associated with the University of Tennessee Medical Center and the dental residency program for 28 years on a part-time basis, and still there. I retired from practice here in 2008 and have been to go over there. The people that are and I told Art a while ago, I feel bad about even talking about this kind of thing when I was listening to the salaries that some of these other people have gotten. But one part of my job over there is reviewing contracts for these residents. The residents are people that have graduated from school. They've chosen to do a 1 to 2 year residency to further their skills and learn some things that they're not touched on in school. When they come out of the residency, like I say, they go into associateships with practices, and so they bring the contracts. They'll get a contract. They come to me, and we review these contracts, see if they how they are and if they're okay. But most of these people go out and they're guaranteed $600 a day. We had one today that was hired by Interfaith, and the residency finishes at the end of June. She'll start with Interfaith the middle of July. It's $600 a day. They pay her malpractice insurance and they give her medical insurance. Interfaith is obviously a nonprofit. They function kind of like the health department. They take insurance from like TennCare and people like this, and those on some kind of reduced scale pay. But anyway, this is kind of what the going rate has been. Dental needs are, as y'all know, is tremendous. And I also spent 21 years in the military and through active duty and Guard. And I don't know, realize, and I didn't realize until in those days, the most common reason for missed active duty in the military is dental needs. And that kind of surprised me when I heard that. But that's the biggest cause of missed combat time in the military. And the dental need, and this same transfers over to school systems. And this is the need that Art is talking about and what we really need to try to address in this county. I bring residents to the Oak Ridge Clinic twice a year. They go down and extract teeth all day long. And we also try to do other community needs the same way. But anyway, we would appreciate, as chairman of the Board of Health and working with Art, would try to appreciate you all's consideration to try to help us out in trying to bring somebody in full time in the clinic. Anything?
Thank you very much. Do you have any questions?
Thank you, Dr. Rainey.
I will say that with our being conservative, we feel like that with a full-time dentist, we would be seeing patients approximately 250 days a year. With that, if we averaged $1,100 a day, which I think is being very conservative, then that would bring our revenue up to $274,288. Our request, total request is, excuse me, get my figures here. Too many pages, sorry. Our total request was $398,030. So for approximately $125,000, we would be getting a top-notch $400,000 dental program. And I feel very positive that we can generate that revenue and even more. We also are still getting the safety net grants. They used to pay us $30 per extraction for adults age 19 to 64. They have reduced that, but then they've also added cleanings. So it looks like we've averaged about $23, $25 range on that. So I think that will bring in, additional $24,000, being very conservative on that. And that money comes from the state. And and then I'm looking everywhere I can for other grants. There's the American Dental Association that has some grants. There's the Trinity Foundation. So if we could find some more of these grants, I think we can offset a lot of the cost from that. But it's a great program. I'm so proud of the dental program.
That dental program, as you know, I've been real close to the dental program ever since I come on commission. And I want to commend Dr. Rainey and yourself for what you've done. And I think that what your ask is a real good return on investment for Anderson County.
I think it is. You just, if you ever have a chance, please come and visit. It warms your heart, the people that, especially coming down to Emory Valley, because they've had their whole mouth. They don't have any teeth hardly. We've pulled as many as.
Record was 149.
So, but but they're in pain, and someday in the dream world, we'd love to be able to provide dentures and things like that. But but right now, if we can get them out of pain and get their infection cleared up. That's our goal.
Yeah, this is unrelated to the dental side, but how's the hepatitis A campaign going?
Very well. Unfortunately, it is growing. We just found out today that in another county that they've had a huge outbreak in the jail. So they were asking for our nurses to go, some of our nurses to go and help because it's a large county and they had lots of cases. So, but we're getting thank you all so much for that time on that, at the commission, because we immediately started getting people come in and calls, and we've had restaurants that have called and asked about it for their workers. So it's going well. Thank you.
Good comment. Good question. Anything else to Art? Thank you, Art.
Thank you,
Dr. Rainey. Solid Waste Coordinator, Jeff Trabaka.
10 to 15 minutes, huh, Jerry? Hello, everyone. I think the reason that Commissioner White asked me here today is there's two main things. This is the first time we've ever presented a budget where we're presenting a budget with a deficit. We have asked for 2 additional personnel for next year. We currently operate with 2 people, myself and 1 labor position. And where we operate out there at the Blockhouse Valley facility, we take in tires, we take in appliances, we take in washers, dryers, refrigerators, batteries, all sorts of what they call universal waste. It's got to be dealt with in specific ways. Some of it's cost. We do actually generate a little money from scrap metal, and we also bale paper and cardboard from 13 county schools and buildings that we pick it up for by hand. Our issue has become, we're not broken, but we're badly bent. We're both getting worn down physically. Christine, who is the labor person, has had several injuries and health issues in the last year and a half, and so she has been on a restricted duty most of the last year, which has meant that I have had to step up and cover quite a bit more of the labor side of things. That's becoming increasingly difficult for me, physically, mentally. It's just become a strain. We would love to have some help. I've asked for 2 people. It would also give us the benefit of being able to possibly open that facility out there. Currently, we're open 1 day a week on Wednesdays, and then the 1st and 3rd Saturday of each month. With more people, we could be open every day. We'd get less complaints about not restricted hours. We might actually pull more material in, maybe generate more revenue. Unfortunately, it's not going to match what the cost of the labor is going to be. But we're providing a service for people out there. For myself, I just can't do what is necessary. I've got a lot of record keeping and paperwork and that type of stuff. I just finished an annual report that takes me from January through March to finish. And so trying to keep up with my job and Christine's job, it's just not working. And when one of us is sick, the other person's stuck. We don't have a fallback person. We don't have a backup. There's no reserve people we can call in to do it. So when that happens, we get behind, and then we fall a little more behind and a little more behind, and it's hard to play catch up constantly. It would be great if we could get some extra people. The reason that would be particularly helpful coming up in the next few years, I don't know, did everybody get the packet that I sent? I put in a 3-year narrative there. I have gone through and looked at pretty much the entire waste management contract from the date it started in 2003. That contract ends in 2023, so we have a little more than 4 years. I've talked to people at the state. Larry Chrisley is the head of the Materials Management Division. The average across the state for landfill fees is $42 a ton. We pay $21.39 plus a state fee of $1.25. So what we are paying is $22.64 per ton at the landfill currently. Every year there is a CPI or consumer price index increase that goes along with that. It's been anywhere from 1% to 4% for the last few years. We're expecting a 1.8% increase this year. What that essentially entails for us is a $20,000 to $40,000 increase in that every year consistently. In addition to that, if you've looked at page 15 of that is probably the easiest one because it's an across the board. When we started this contract, we were putting about 35,000 tons into the landfill every year. Now, over the course of the first 10 years, that number went down. I don't know whether it's primarily economic, but by 2008 and 2009, where the economy and
everything was dropping, we were down to about 28,000 tons. It has started creeping back up. And so with that, again, every 100 tons we put in there is $2,000. If we increase by 1,000 tons for a year, that's $20,000. We've been hitting anywhere between 600 to 1,000 tons increase every year. And at the moment, we're at 764 tons above, 727 tons above where we were this month last year. That also makes it difficult for me because when I'm trying to predict and gauge, I'm trying to look at averages, and the averages don't work across the board because if you look year to year, it just doesn't work. And so I have to try and focus on the last 3 years, and there are particular months, March, May, October, and November tend to be months where we have a consistent increase. The other months fluctuate up and down. February, it seems to be the one month of the year we consistently stay down low. I think it's mostly the weather. When I'm looking at these budgets in January, I only have 6 months worth of data to look at. So for this year, when I'm looking at January, we were up 350 tons. And I'm trying to gauge what the next 6 months is going to bring us and what the next year is going to bring us that I'm trying to budget for. Well, the year before that, or actually 2 years back, in January of 2017, we were down 3 tons for the year. By the time the year ended, we were over by 1,100 tons. May was like 500 tons in 1 month over what we normally do. So it's very difficult to project and gauge where that's going to go. So in looking at that and looking ahead, once this landfill contract ends, if we get hit with a $40 a ton landfill fee, and we continue to see 1,000 ton per year increase, by the time we get to 5 to 10 years out, we could be looking at close to $2 million a year just for landfill fees. That's the entirety of the solid waste budget at the moment, about $1.8 million. I've got 4 years to try and figure something out. Work with the Solid Waste Board, work with you guys. I do have some ideas. There are some companies around that actually convert solid waste or garbage into a product that is mulch. It can be used as a fuel. It's got the same value as coal in terms of a fuel rating. There's a place in Middle Tennessee called Waste Away that does that. There is a company out of Georgia called Allied Energy Solutions or Services. They do the same thing. They also combine that with a process that converts some of that material to diesel fuel. The Georgia company actually wants to work on the landfill site, so I don't know how that would particularly fly with Waste Management in terms of, because they actually do own that facility. When we went and toured the Waste Away facility, and I believe some of the Solid Waste Board, Chuck Frintz went, Mary Murphy went with us when we went. We talked to them, and what they provide for the counties is essentially a design, and then you build it and you staff it. For the amount that we generate a day to handle the material that we handle, which is about 115 to 120 tons a day, it was going to cost us $15 million just to build the facility, and then it would be probably at somewhere between $300,000 or $400,000 a year to operate it. It's not going to be realistic for us. There is a new company in the Upper Cumberland Development District right now called Just Be Green, but they've actually converted to the Upper Cumberland Waste to Energy Program. I've been talking to a woman named Lisa Luck at the Development District in that area, and she's trying to get a hold of the contact people for the mayor. I'm not sure which town, the city that's the primary town, and also the person from this company that's doing it. But they are going to be building a facility for the Upper Cumberland District, investing $150 million of their own money to do it, to accumulate all of that waste from the surrounding counties and municipalities and converting that into both diesel fuel and this, they call it a fluff material, but essentially it's a sterilized garbage that looks like mulch. It can be compressed into fuel pellets or used as mulch, multiple uses. That's what I would like to pursue, or at least see if we can get them to come talk to commission, talk to the Solid Waste Board, and look ahead. If I am the guy who is out there pulling dead deer off the road and digging up faucets at the convenience centers and throwing tires by myself, I'm not going to be able to do that part of this job. I need some help on the labor side so that I can focus on this.
Questions or comments?
Well, he's right. I've seen him operate, and he's doing a lot of the labor himself, and that's taken away from his manager duties. I agree with him. He needs some help.
Yes, please. For somebody who will, Jeff doesn't want to pull dead deer off the road anymore. Please. Any other questions?
Good job.
Thank you, Jeff. Good presentation. Next, we have the discussion of growth and vision plan for Anderson County. And what we've seen tonight is we've been approached, you know, it costs a lot of money to do business. And I think we're at a place in commission now that we're under the 81 Act. We as commissioners need to try to help and develop and work with the mayor or whoever committee that we have a growth and vision plan to help finance going forward so we're not always looking at a tax rate hike. And I think Oak Ridge has put out a book, and I'll just leave a quick little excerpt of that. And it's the intent of the City Center 2030 strategy for Oak Ridge is to explore ways to accommodate a new generation of housing, build a vibrant, walkable urban district, and offer retail, food, entertainment, cultural venues that attract the next generation of Oak Ridgers. So what they're looking at there, you know, by doing that, that's going to bring in more retail development, which brings in more money, which cuts down on the tax rate. Now, the preserve that you've seen in Oak Ridge that we went out there to the groundbreaking and things, and you hear the city of Oak Ridge talking about part of the big success that they're having now is Main Street. How many years have we all sat around and waiting on something to happen? You know, that we've actually had to go to a different county because back when I first got on commission, it was all about buying local, you know, preach that every time. Now we've got the opportunity to spend our money at home. And look what it's done for Oak Ridge and just the housing and stuff. So I think that even I've got a little excerpt here from Knox County. County's new growth plan delayed until July because they're working about how to do this. But I think that's what we need to do as a county is to come up with a growth and vision plan. So that's basically that. And then maybe next month, you know, think about it. And in the meantime, you know, do some emails or what we can do, because I think between Budget Committee, Operations Committee, and the mayor and whoever else that we can, people from private sector as well, you know, we can probably put something together so we're not sitting here and faced with doing a tax hike. But
Good comment.
any questions or anything on that in rebuttal? Next is we got new business, groundwater contamination. And I think Catherine was going to talk about that. I think she had to leave. So, Tracy, do you want to talk about the intergovernmental committee about, this is kind of what they're doing, is taking up this groundwater contamination?
Yeah, I think it's just the mayor touched on it. I think the mayor summarized pretty good in that intergovernmental committee. TDEC has really taken a hands-on approach with TVA, and I think that's paying dividends for everyone to make sure that it's being done environmentally correct. And I'm anxious to see how TDEC responds.
Mayor, have you got anything on that? Okay. Commissioner
Yeah,
Miller?
I attended Oak Ridge Site-Specific Advisory Board meeting a few weeks ago, and they were talking about the monitoring of groundwater primarily across the DOE areas, okay? So that some of that's Roane County and part of it's Anderson County. But it was really informative because they have thousands of these wells that they monitor on a regular basis. And they've really defined well the few places that have issues, and have confirmed that they're not issues most places. And so in any case, the Oak Ridge Site-Specific Advisory Board, their personnel have access to all these studies and all the stuff that's been done. And it was a couple-hour meeting. I was really impressed as they went through area by area by area and showed that, this place has 300 wells, this place has 600 wells, and then it shows the data they've been keeping for, God, some of these things are 20 years. They've been sampling this stuff just to make sure that nothing is getting away. There's a number of places where they put in city water to people that had wells, but they continue to monitor those wells. Guess what? They've never found any contaminants in their wells, even though they paid to supply them with city water. So there's things going on with ground contamination, but from the DOE side, I think they got a pretty good handle on it. It's going to be other places we have to look at, but like our landfill that we just, now the area could become a park. That's been monitored. We verified that it's not there. I think a place we're going to have to watch carefully, though, is the Bull Run Steam Plant area, because keep in mind, a number of those ash storage sites are unregulated. There's only a few of them that are regulated. And so the unregulated ones don't have the same kind of monitoring that the regulated ones have. And so we probably want to look at that carefully.
Anything else on that?
We got Tracy looking after that.
We're all looking.
Yeah. Okay. All right. Any other business to come before this committee? Commissioner Scott.
Good evening. I've been reviewing the plan that EMS has put out, dated March 2019. And in the section that's regarding the alternate funding opportunities, it says insurance payer mix is not something that can be regulated or controlled by EMS. That being said, opportunities for alternate funding should be considered. I mean, it's obvious. We've listened to Nathan over the course of the years, and his recent budget that he's brought to the budget committee is stating that he needs more help. He needs more equipment. He needs an array of things to keep EMS afloat. I've been doing my research, and I've been reaching out and talking to other commissioners from other counties at conferences and just nearby, whether it be Knox County, Scott County, Putnam County, Cumberland County, et cetera. And it isn't cheap at all. They're all having issues. But Knox County uses AMR, which is also known to many as Rural Metro. And they have different plans for different counties, depending on what the people are looking for. This evening I've asked Chris Block with AMR to come in and speak. I apologize that it wasn't put on the agenda sooner, but it was due to calendar conflicts and so forth. And with everything being brought forth this evening, it was best to try and fit it into new business. So if you wouldn't mind, I'd like for him to speak.
You know, we can give him 3 minutes, but we'd probably, if we're going to do a question discussion, we probably need to put it on the agenda for next month.
Can you let him speak this evening, some, and give you some information?
Is that okay with the committee? Yeah.
Please. You can step up to the podium. Thank you.
I brought a handout just to provide a little bit of information on our company.
Sir, Chris, was it Chris?
Yes.
Do you mind giving the mayor a copy and Mr. Sweet a copy?
I just brought 10, I'm sorry.
Okay,
I'll get you copies.
Yeah, I'd like for them to have copies.
You bet.
Go ahead, Mayor, I'll need your time.
So I know I have a very limited amount of time to speak. My name is Chris Blatch. I'm the Regional Director for AMR here in Tennessee. We operate in 15 counties throughout the state. On the top of the handout, just a little bit about our company. Our parent corporation is a company by the name of Global Medical Response. And underneath Global Medical Response is really two business units. One of them's in air wing, so we do helicopter, medical transport, as well as fixed wing aircraft. We're the largest air medical transport service in the world. And then we have the ground transport side, which also includes our fire business. And we're the largest ground ambulance provider in the world. So just the cover sheet, we transport about 13 million patients annually. We have 38,000 employees nationwide. We have over 4,000 communities that we service. We have 335 air bases. Here in Tennessee, we have 30 to 35 air bases. We do UT's helicopter program. We do Erlinger's helicopter program. Middle Tennessee, West Tennessee, throughout the state, we have air medical. We're CAS accredited. The Commission on Accreditation of Ambulance Services, we are the only accredited ambulance service in the state of Tennessee. And that covers all of our East Tennessee operations, Knox, Blount, Loudoun, McMinn, and Polk. We've got over 7,000 ground ambulances nationwide, 306 helicopters, and 106 fixed wing aircraft, which will include Learjets, and we do transports patients worldwide. Here in Tennessee, we have over 1,000 employees. As the commissioner stated, we provide 911 ambulance service to Knox County for no tax subsidy. We do it for free to the county. We support our operations on user fees. So we bill the patients for transports, and that's how we run our operation. In Blount and McMinn County, we also have zero subsidy for service. We have a different model than many traditional EMS systems in counties. We staff to demand. So Knox County, for example, we have roughly 30 ambulances on the road at 3, 4 o'clock in the afternoon, and we have about 10 on the road at 3 o'clock in the morning. So that's how we're able to save money. We also have national buying power for medical supplies, ambulances, and so forth. In Knox and Blount, we have very strict operational performance standards. So our standard in Knox and Blount is 10 minutes, 90% of the time. And if we don't meet those response time requirements, then we pay high penalties. So if we hit a level 0, which is no ambulances available in the system, we pay a $5,000 fine for each occurrence. We've never been below 90% compliant in Knox or Blunt in the time that we've serviced those communities. So I believe I'm up against 3 minutes. I'd be happy to answer questions. I'd be happy
Well,
to.
I think the thing to do is the reason why that we have an agenda and we publish it so the public will know what's going on and, you know, they can be here. But I'd very much welcome for you to come back next month and just put it on the agenda.
And I appreciate you allowing me to speak this evening. I would like for it to be on the agenda for next month. It's just, I wanted to at least be able to introduce this to operations, figuring that this is the best place to bring it first. This is not anything that will flush or throw anything that we do presently have away, in the sense that this is a company that does acquisitions of not only the equipment and facilities, but the people that work there already. So I'm looking to help save us, being us the taxpayers, let alone us the county, quite a bit of revenue. And I don't want to see a tax increase by any means. So I thought it was, simply due diligence to the taxpayers to do some research and reach out, to do what I can at least. But I would appreciate it if it was on the agenda at least for next month. Sorry.
Appreciate your effort.
Thank you.
Yeah, I'd like to ask a question, the same question I asked Nathan. What do you pay your entry-level EMTs starting pay?
So entry-level EMTs, basic EMTs in Knox County, it's $10 an hour. For EMT advanced, it's $13 an hour, and paramedics is $15 an hour. And then we give them 2% credit for each year of experience. And we do credit their full experience when we hire them. So if we have a 10-year employee with AMR, paramedic, he's going to make the same rate as a brand new paramedic with us that has 10 years of experience. And that's how we're able to recruit. We also pay relocation bonuses and sign-on bonuses for paramedics and EMTs. And currently, we're running EMT programs in our Knox operation. We held one the end of last year. We held one the beginning of this year. We have another one scheduled for May 20th. And for 24 positions, we have over 40 applications right now. And we pay their tuition. We pay them minimum wage to sit in the chairs and attend the course, and then they sign a 2-year employment contract with us. And then we have scholarship programs for the advanced training as well as paramedic training.
Sounds good, thank you.
Thank you.
Appreciate your comments.
Thank you.
We look forward to you coming back next month with a presentation, and we'll be ready.
Very good, thank you.
Anything else?
Yes, sir.
Yes, ma'am.
This morning, Roger came to me, and I just wanted to make you aware, the fire watch down at DARC building probably has about 3 more weeks of payment. And to date, the county has paid $22,648 for these 2 individuals to walk around and watch for fire. And the state fire marshal has said that plan was only a temporary plan and there needs to be a permanent fix. I reached out and have reached out multiple times to Emory Valley Center to see what the plans were. I did get an email back in February from the facilities director, Kevin Hicks, and he said he was working with another elected official and he had communicated with this individual and he was awaiting the approval he was requesting from County Commission in order to make a move. The move he was asking for was that MBI, which as the county knows, we did finance those plans. I think that was $11,000. MBI would submit plans for review, but their plan would be contingent upon being allowed to occupy a separate area of the building. And again, this is for the daycare operations. This isn't the Emory Valley, the clientele in the main Emory Valley building. And so that official, I didn't want to step on their toes and make the request in advance of them, but it wasn't on the agenda. And then this morning, Roger comes to me and he tells me, you know, the clock is ticking. I'm not going to have any more funds. And so I just am throwing this out there. Gives you a little bit of time to think about what you would like to do on that particular issue. So I didn't want us to run out of money and then the fire watchers are not down there and then it's, Mayor Frank, why didn't you tell us what, you know, what are you going to do? So.
You got enough funds to last till next month?
I don't know exactly. I can get you exactly the last workday if you would like. I can email that to you.
May I recommend that we put it on the agenda for next month?
Yeah. Yeah, we can do that.
And we may ought to get it on the budget committee as well.
Yeah, to me, this is throwing money away. You know, we keep 22,000 people walking around. A firewall consists of metal studs that all commercial buildings are built out of.
Yeah,
and
we
the
need
rating is how many pieces of sheetrock that you put up.
Yeah.
It's for every hour, it's every how many pieces of sheetrock.
That's something our prisoners could do.
Yeah.
Yeah.
It's real simple, but to keep paying $22,000 firewall, something's got to give. I mean, we just keep going. To me, you know, we spend a lot of money down there.
Well, at one point in Emory Valley, they said that they were going to do that.
Right.
Okay, and now it's just not happening.
Yeah.
Well, I think they went out to bid and the prices were high. And so now they have a different business plan. And as we're talking about the taxpayers tonight and other options that we're looking at, that building is a continuous bleed for the taxpayers of Anderson County. And my recommendation would be to seal off the court, to give them their standalone heating and air, and until the county has the ability to improve the other area to get fair market rent, that it be vacated. And I don't know if we need some kind of cost-benefit analysis, but it's nothing against the folks that are occupying there, but we have utility cost, insurance cost, maintenance cost. We have a full-time personnel down there doing the maintenance. We have new needs. We have a new roof cost. And if you think about all the vacant space that is in there, there's very, very little of it is actually occupied in that main building.
Right.
So we are heating and cooling and doing all of that for an entire facility that we're only using a fraction of the facility. And so I think it's time for just some bold action. ESG is just about completed their assessment where they're going to be coming with some opportunities for us to improve. We had them look primarily at Jolly Building, DARC, and this courthouse. And what can we do? We know we have needs. What can we do through savings to improve these facilities? And that includes even the windows on the Jolly Building and some things like that, I mean, to improve our assets. But we will have that. I was hoping I would have that tonight, but I don't. But I did want to make you aware of this fire watch issue.
Well, if I'm sitting at home and I'm watching this and we're talking about all the needs and money to come up, it seems like we're just wasting a lot of money down there by just heating and cooling and all that when it's space or the taxpayers are doing that.
Yes.
Yeah.
Yes. Yeah.
Anything else?
So let me ask a question. I think the Mayor, Chairman, I'd like to know, what is the recommendation then? I mean, I think you're bringing up obviously a point we need to address. I mean, I hear we could put up some
The firewall.
We put the
consists of- yeah.
firewall up, you mentioned, Mayor mentioned doing, just shutting it possibly down altogether. I mean, I guess for me, I'd like to know what the mayor's recommendation is to us on operations. And I think you may have said it, but I'd like for you to just.
Well, I mean, I don't want to step on toes and hurt feelings, but I think the folks that are in there need to vacate. And then we need to take care of the General Sessions Court. And then we need to come up with a plan to improve the other side. And then at that time, we can do an invitation to put it up for lease, whether that's fair market lease for individual tenants, whether it's leasing to the state of Tennessee, whether it's reaching out to Roane State. But I think the bleeding has gone on long enough. And it's the facility, when I take people there, I've taken an architect there, I've taken ESG there, it needs some work. It does have good bones, and that's why Commission did invest in putting the court in there. It's a valuable piece of property. But, that's my recommendation. I don't want to go back in time, but we did have some commissioners who said, don't do this. Let's go ahead and put up the firewall. Let's not waste money on people walking around. And that was a debate that took place at the commission level, and it came down on the side of, we had folks say, no, this will be handled quickly. Well, they're not here tonight, the ones that said it was going to be handled quickly. And it's not been handled quickly, and we're $11,000 into plans, and we're $22,600 and something into firewalkers. And if you all have seen their job, these guys are bored to death, and then every hour they walk around to see if there is fire, and then they mark on a clipboard. So.
Well, I appreciate your feedback, and, obviously there's a cost with all this. And there's a need, obviously, for the Emory Valley, in their mind, to have it there.
Sure.
But I don't know what the options are for them. We haven't heard from them, but, if it's $25,000 in cost, call it, including utilities or something, it might be more of value for us to give them $3,000 or $4,000 and help them find a spot. We would save money probably, but I'm not suggesting that's the answer, but I think it's something that needs to be addressed, and I appreciate you bringing it to the attention.
Well, and I don't want to be a hard heart, but I downloaded the 990s because I wanted to see where are they at. I don't want to be, Cruella up here advocating for something against this program. There were almost $1 million revenues over expenses last year. So on the last 990 that I downloaded. So they have funds. I love the organization. But again, this program is not a program that is specialized. It is it's for paying folks in the community. And the effect, in my opinion, from a free market perspective, is that the other daycare centers in Oak Ridge have shut down because they don't have the benefit of having a government entity pay their heat and air and insurance and give low-cost rent. And so from a market standpoint, it has left people with one option. And I'm happy to entertain. I actually met with this individual on AMR, but I do hope we have an open discussion about that as well, because that is kind of where we are with the ambulance business, and one company pretty much getting into a position where they're going to control the market for EMS. But I'm happy to look at that and explore it further as well.
Mr. Chairman, should we put this issue on the agenda for next operations?
Yes, but
do we have time?
I will send you tomorrow, like I'll get from Roger, what the last work day is. Because from there, my recommendation would be, until we can work this out And we want to be a good partner with Emory Valley. And if we make a decision to do something different, whether it's build a firewall, I think they should start picking up the tab on the firewalkers. I don't think it should be another appropriation from Anderson County government. I think
It was only a temporary.
it was, yes.
I think definitely put it on the agenda, even if it's solved, then we can just, matters already taken care of.
And then give them an opportunity to come before us
Yeah.
and tell us what they got planned.
Exactly.
But I'll just to make it a motion so we don't have to worry about getting it in by deadline, make a motion that we put the Emory Valley Center on next month's agenda for operation.
Any discussion on the motion? All in favor?
Aye.
Any opposed? Motion passed. Commissioner Scott.
Thank you. Just a brief update. Within the next couple of days, the 4 commissioners and Mayor Frank are going to go over to the Darcy building. We're going to look at that building at that time. And it may be a good opportunity for us to really look at the footprint of the other businesses that are utilizing that facility. We're also going to look at the Jolly building the next day, or one or the other. Thank you.
Thank you.
Good meeting.
Hey, Brian.